And up next, our next guest says that childbirth really took its toll on her body, but after struggling with a low libido, incontinence and a loss of sexual confidence, mum of three, Gina Sigo-Bodler, decided to take action.
After meeting women's health expert Dr. Sarah Jenkins, Gina opted for a new type of rejuvenation treatment known as the vampire vagina, which involves injecting a patient's own blood into their vagina.
Yeah, Gina says she's never looked back and joins us now to share her story alongside Dr. Sarah Jenkins, who's here to explain a little bit more about this type of treatment. Thank you so much for coming in, Gina. It's lovely to meet you. Well, we'll find out a little bit more about what you've been through and the difference it's made in just a moment. Dr. Sarah, it sounds like the sort of treatment with the title and the name, it sounds sort of a little bit horrific. It sounds a little bit sort of self-indulgent. It sounds sort of, it doesn't...
Scary a bit. Scary. Yeah.
But actually, when you hear Gina's story, what she's been through and the difference it's made to her life, you understand the fundamental importance of this for certain women.
Absolutely. So first and foremost, I'm all about empowering women to have good quality of life and to be able to manage medical symptoms that are associated with post-childbirth, with menopause and just being a woman, basically. So when people talk about vaginal rejuvenation or vampire vagina or vampire facelift, this isn't an indulgent treatment. No. This is actually managing medical symptoms that there is no other kind of treatment available for. So that's why I see so many women with very similar story to Gina. In fact, you don't even need to have children to have problems with incontinence and with vaginal atrophy and all those other associated symptoms that I treat.
So tell me about the actual treatment. How does it work and how do you do it?
OK. Little anatomy lesson, if you don't mind. So this is actually the vulva.
Yeah.
OK, so when people say vagina, for a medical person, the vagina is actually the birthing canal.
Right.
Okay? So this is our vulva. We need to know our vulva. We need to check our vulva. When it comes to the treatment, we actually use tiny little Botox needles, so it wouldn't even hurt any more than Botox.
Okay.
And we inject into the clitoris, which is called the O-shot, and then we inject all around the vagina, and that basically helps to rejuvenate the skin.
And what are you injecting?
You're injecting PRP, which is platelet-rich plasma. So you take your patient's own blood, and it's like this liquid gold, essentially. You inject it in. That sends signals to the body to say there's tissue damage.
Right.
And because of that, all of these lovely growth factors and all these healing things, cascade of things in your blood comes along and causes collagen and elastin to be reformed. So it thickens that skin back up and also helps with natural lubrication. And it also helps to tighten a little bit where things have been made out of shape.
It's not as simple as just taking your own blood out and injecting it in. You have to go and spin it. You have to sort of separate it. And so there's a whole series of things that has to be done before it can be re-injected.
Yeah, and it can only be performed by medical practitioners that are correctly trained, because obviously, you know, it's an intimate examination. We have to be mindful of our patients and their story that they've been through, and we've got to safeguard vulnerable people.
Yes, absolutely. And Gina, this all started for you basically back in 2004 with the birth of your first child. Tell me what happened.
So Dara was born, you know, vaginally, but I had a third-degree tear.
Right.
So that was kind of like quite traumatic. And once I delivered, I was discharged home with a leaflet to say, you need to do some pelvic muscle floor exercises.
So it's basically take your baby, here's a leaflet, go and get on with it, essentially.
Yes, and nobody actually explained to me, you know, what they do and why I need to be doing it.
The importance of them,
Yes, and at that time, first child, you know, away from family.
You're just muddling through, trying to get everything okay.
And thinking people are emphasising you got to breastfeed, you need to make sure you're keeping yourself well, your child is looked after, so you've got the health visitor always on the door. And at that time, I didn't think about it. And before you know, again, I was pregnant.
Right. This time with twins,
With twins, yes. Right. And I didn't know I was pregnant, so it was kind of like a shock. And I was almost like about 11 to 12 weeks by the time I found out, because I already had a toddler, so things were quite busy. I just started a new job in a forensic unit where, you know, it's quite risky there, you know, for anybody, let alone to say that you're pregnant as well. So by the time they did some scans. They found out that one of the other baby wasn't growing properly.
Yes.
So I had all that stress to think what's going to happen. And I was having regular checkups with, you know, my obstetrician, who is amazing. And he had to kind of like seek for some more support because Ryan, the second twin, you know, just wasn't growing. So at 27 weeks, I had to deliver.
Yes.
And that was me going in, and they said, we got to do something tomorrow. You got to stay in. I got a toddler at home. I've got a husband.
Yeah.
I haven't even prepared for the twins. And they were delivered, and it was
C-section this time?
Yeah, C-section, emergency C-section.
Yeah.
And, you know, it was quite traumatic in the sense that when the babies came out, baby A, oh, it's a girl, baby B, it's a boy. And then 7 hours later, I had this entourage come in to say, what were you told? It's unfortunate we don't know what baby A is, because he hadn't finished developing properly. So when he came out, you know, his organs were still forming. So they said it was on a Friday, and that was Friday when the 7/7 happened.
Right, okay.
So everyone was quite busy then. So they had to take, you know, some samples to take to Southampton Hospital, and we wouldn't know till Monday. So it was a weekend of just waiting and not knowing. And then on Monday, they finally came confirmed to say, no, he's actually a boy.
Okay.
So
It's a lot of trauma, anxiety and worry and concern.
yes. And straight after that, I think I stayed in hospital an extra week, and I had pulmonary embolism and preeclampsia, which meant I had blood clots on my lungs. So just thinking I nearly died with the twins. So all that going on. At that time, then no one emphasized about pelvic exercises or anything. So it was all concentrating on what else was going on. And it was quite a difficult time, you know. Ryan had to be transferred to King's Hospital because his bilirubin level rose up, and it meant he was quite jaundiced. And I had to leave the other baby, Jaden, in Southampton with my husband.
Crikey.
And, you know, the hospital was a massive hospital. And from then, I had a treatment plan from then. And finally, after 4.5 months of the back and forth in hospital, Ryan was discharged. And sadly, we took him back to King's Hospital for a checkup, and on our way back, he passed away in the car.
Oh, I'm so sorry.
So you've gone through all this trauma
so
anyway.
much.
Yes.
Physical trauma, emotional
Mental trauma.
It
yeah.
didn't stop. You have another child, eventually got pregnant, had another child. At that point, though, Gina, so you've had these 3 births with all the trauma that's come with them, and suddenly you feel like your body is not your own. You're certainly struggling with what's happening for you physically as well. So why did you discover that this treatment was going to be the answer to what you were dealing with?
I think it's something I've always kind of like wanted to have done, because after the first birth, you know, definitely I just felt, you know, lost control, you know, in terms of like, you know, leaking, and most of the time always wanting to know where I can find the loo.
Bathroom.
And of course, you know, sexual intercourse, you know, when you start to lose that feeling, it's quite scary. And you also want to maintain a relationship with your partner. And I've got a loving husband, Kuda. And, you know, it pains me, it was kind of like quite difficult for me to see him, you know, encourage me, but I didn't have confidence in myself.
Yeah.
But he was kind of like quite encouraging, and met Dr. Sarah through work, and we always talked about, you know, women's health, and she always said to me, I will get there and I will find you.
Yeah.
And, you know, we'll find a treatment for you. So when last year she approached me to say she's found something, I was so excited.
And Sarah, you must see this all the time, this amazing change in women with this treatment.
Yeah.
How does it change their lives?
Well, basically, like we were saying earlier, it gives women back their quality of life.
Yeah.
Because if you're waking up thinking, how is my vulva behaving today? Like, is it going to be a bad day? How many changes of clothes do I need to take with me? How many pads do I need to wear? Are the pads that I'm wearing going to give me thrush? Am I going to get like a nappy rash, essentially? Where's the toilet? How do I do this journey? How do I get to work? Do I smell of urine? You know, these are all the things that women come and they say to me, and they don't need to have had a traumatic childbirth experience. They don't need to have had children at all.
And has all of that gone now you've had this treatment, Gina?
To be honest, you know, most of the symptoms, you know, have, you know, kind of like reduced. For example, like going to the toilet at night, I used to be up and down at
all
least,
night.
you know, 3, 4, 5 times.
Which then, of course, affects your sleep too.
And, you know, you're waking up, you're still feeling, you know, quite tired, and sort of like the dryness as well, you know, and I just feel that, you know, that sensation's come back, because I think it was after 2, 3 months I started to feel, you know, that, you know, something's actually changed. And I think maybe because I went in with quite a positive mind
approach,
to it, because I just really wanted it, you know, to work. And I had, you know, I had my trust in Dr. Sarah, because I knew this is, you know, a medical person who's researched.
Yes.
And the way it was all done, you know.
And was also prepared to listen to you too.
Absolutely.
That's the other thing. Thank you so much for joining us this morning, ladies.
Sounds like you've got your smile back, and your husband, I'm sure, is enjoying it as well now. He's got his wife back, who's up there, and sort of, you know, that must be really, really important for the two of you. So thank you for sharing your story.
Thank you,
Sarah, it's good to see you as
well.
well. Hello. Thank you for visiting our This Morning YouTube channel. We upload tons of new content every single day. So hit the subscribe button, like all the videos, and don't miss out. We'll see you in the morning.
For all of that, a story about an extraordinary act of kindness when Kate Dickinson's healthy baby girl, can you hear her? Mary, was just 1 month old. Her health began to deteriorate, and within days she was on life support with acute liver failure.
Yeah, doctors told Kate that finding a suitable donor for Mary would be like finding a unicorn's liver, so the family prepared for the worst.
But it was a total stranger, Holly Thorpe, who changed everything. Kate, Mary and Holly all join us now to share their story. Good morning, ladies. You are gorgeous.
Isn't she just delicious? Look at that smile.
Gorgeous. You are. So tell me a little bit about how it all started. Because you had her and she was perfectly healthy. And then what happened?
She was, yes. So she was fine for about 4 weeks. We were discharged from the hospital, the health visitor, everything. She was just a normal newborn baby girl, really. And then when she was about 4 weeks old, we noticed that her skin looked like it was changing colour. And then
going yellow?
Yeah, going yellow, yeah. And also, in hindsight, I now know that the colour of her nappies was changing, which I didn't realise at the time was a sign that something was wrong with her liver as well. But we just thought that, you know, jaundice is really common. It's, you know, it happens to a lot of babies.
Yes.
You know, so... But we waited a couple of days and it got worse, and then the whites of her eyes went almost greeny yellow, and then at that point we took her to A&E. And when we took her there, she had some blood tests straight away, and then...
Thanks very much.
They showed up straight away that there was a serious problem with her liver.
Did you know? I mean, because seeing her, she's so curious and full of life now, and so vital. Yeah. Did you notice any change in her energy and her temperament at all?
Not really, because she was only 4 weeks old, and I remember thinking that she was very, very sleepy. But then newborns are. Yeah. Newborns do sleep for most of the day anyway. But I think she was extra sleepy. Like, she barely woke up, you know, in that time. And then when she did, she would just feed and go straight back to sleep.
Yeah.
But yeah, in hindsight, I now know that was another sign, the lethargy as well.
So you got her into hospital, and she sort of, they quite quickly worked out that she had this issue, which I can't begin to imagine as a parent of a newborn, for you and her dad. That moment must have been absolutely terrifying.
Yeah, it was. I mean, at that point, we didn't know exactly the extent of it. We didn't know how serious it was. We were just told that we had to be transferred down to Leeds because that's a specialist centre for paediatric liver problems. So we were transferred to Leeds, and then, you know, as soon as we got there and she had some additional tests, we were told that it was acute liver failure, which just... You don't expect to hear that about a newborn baby. You hear of liver failure in adults, but I'd never heard of it in children before, and it is quite rare. But they've never found a cause for it either. They say that in about half of cases, they never find the reason for it.
So they found a donor, first of all, but there was a problem.
Yeah, so after a couple of days, she deteriorated enough to qualify to be put on the transplant list. So she was put on the national super urgent list. And then within about 12 hours, there was an offer of a deceased donor.
Yeah.
But then when that arrived to the hospital, it just unfortunately wasn't the right shape or size for us, so they couldn't go ahead with it. And it was at that point when it was suggested to us by one of the surgeons that have we considered live donation. But it was a slightly more longer and more complicated process, usually, to find a living donor. And they hadn't done it before in an emergency situation.
Wow.
But it was our only choice, so we put an appeal out on social media to try and find somebody because nobody within the immediate family was suitable. It was too soon after giving birth for myself. My husband was physically too tall and too big. So we put an appeal out on social media with the criteria on, just hoping that in that time either another deceased donor would come through or we would find somebody.
But you were told, literally you were told that it was like finding a unicorn's liver. That was the lengths it was going to be, the miracle it was going to be.
Yeah.
And then suddenly that miracle came along.
Yes.
In the shape of Holly. So you must have seen this appeal on social media.
Yes, I saw it. I was on holiday.
Right.
And I saw it and I kept it a little bit quiet to my family. Some of my colleagues shared it on social media. So it did take me a few days to think about it. And when I got home from holiday, I filled in a form and,
And you fit the criteria. They're quite specific criteria that it had to be, right?
Yeah, it had to be the correct blood group. And it was primarily about the size and my weight. So I think I needed to be under 50 kilograms to be able to donate.
And how do you broach that with your family when you say, look, I've just seen this appeal on social media and I feel like I might be the right fit to give part of my body, one of my organs or part of my organs.
Yeah.
Vital organ.
I mean, that's quite a step, isn't it?
I think when I told my husband, he said, sleep on it, see what you think tomorrow. He wasn't surprised. He thinks I'm quite spontaneous. But this was taking it to another level.
Yeah, just slightly.
He was very supportive. He had his concerns, but he was supportive overall.
So then what happened next? What was the procedure like for you and how did it work?
So it was very quick. The next day after I'd sent my form, I was in for all the tests and the team were amazing. It was very slick. And the day after, I was prepped for surgery. But it didn't go ahead that day because Mary needed some further tests. But the following day, so it was about 3 days in total from filling in the form to the surgery.
Just come back from holiday and all of a sudden you're having this operation where you're having part of your liver donated to a baby.
Yeah.
I mean, how were you feeling at this stage, Kate, when you've suddenly had this stranger seen this appeal?
By that point, Mary had deteriorated quite badly and she was on life support, essentially.
Yeah.
And we knew that she had probably a few days left to hang on, and we knew that if we didn't find somebody and it went ahead in that time, that we stood the chance of losing her, and it was a very real possibility. So it was obviously it was a really hard time. I don't remember a lot of that time actually, but I do remember being told that somebody had been matched and just that feeling of who on earth is this hero, And I know Holly hates us calling it that, but I remember that feeling of, there's somebody out there doing this for our child and we don't even know them. And that feeling of, I always say that in the worst possible time of our life that we could have experienced, we feel like we actually saw the best of people.
Human beings can be incredible. They can be terrible, but they can also be absolutely awe-inspiring and amazing. What was that moment like when you first all met each other?
It was quite a while after the transplant. Mary had the transplant on June the 1st and we met at the end of November because when we were discharged at the end of June...
So you don't meet at all before?
No, it's completely anonymous.
Wow.
For ethical reasons, to protect both sides.
I see.
And then both sides have got to agree you want the microphone?
Yeah, you've got to make sure that everybody's happy to share their information.
So it was it was quite a while because when we came home, Mary had to isolate for 3 months to protect her from infection, and it's something we still need to be careful about now because of the drugs that she's on.
It was a really emotional moment.
It was, yeah.
Did you
really
walk into a room together?
did,
What was
yeah.
there?
So it was at St James's Hospital in Leeds, and David and I, our husband, we turned up and we were just really nervous. We were just really excited, nervous. We'd thought about and anticipated this moment for nearly 6 months, and I just felt this overwhelming feeling of I just want to give her the biggest hug.
Yeah.
And we walked into a room. Holly was there, and I couldn't say anything. I couldn't speak. I just gave her a huge hug, and the love that we feel for Holly is just
by the way,
off the scale.
it's absolutely tangible. As you sit there on the couch, the three of you together, you can tell how much you love each other. And you're actually godmother now, Holly.
Yeah. Yes.
What made you choose Holly?
We couldn't think of anybody better to ask, and also it was a gesture that we wanted to make as well. It's just one way that we can say thank you. It's very difficult to be able to say thank you properly. There isn't really any gift or any words that we can. That we can give that would say thank you enough, because what she's done for us is just
it's a miracle.
So unique.
And the NHS as well. I know that you want to thank the NHS because they've done some extraordinary work.
They were incredible, and we both feel like they went above and beyond to make it happen in the circumstances that we were. And she was, from start to finish, she was just looked after by the most incredible team, and still is looked after by them. So we feel incredibly fortunate, even though what happened to us was really hard and really sad, we feel like we've come out of it with the best possible outcome.
Well, you have the most vibrant, curious, excitable little thing.
She is.
Bubbling away and smiling on your lap, which is so special. And I think, Holly, from your perspective, knowing that has come, there's a little bit of you in her, that just must feel extraordinary.
It's absolutely, it's probably, other than having my own children, it is the thing that I will forever be most proud of.
Yeah.
And I'm so grateful that I've been able to come into Kate's life as well, and Mary.
Yeah, absolutely.
And we're grateful that you came in and shared the story. It's been lovely to meet you. As you see, I think you've nicked Kat from me. She's completely Mary obsessed, who is absolutely gorgeous.
Oh, she loves an audience.
What an amazing team you ladies are.
Yeah.
An amazing team.
Wonderful
Thank
family.
you for coming on.
Thank you very much.
Oh, hello. Thank you for visiting our This Morning YouTube channel. We upload tons of new content every single day. So hit the subscribe button, like all the videos, and don't miss out. We'll see you in the morning.
Now, after making her acting debut in Byker Grove at the age of just 14, Jill Halfpenny has gone on to become one of the most recognisable faces on British TV.
But behind the scenes, she spent years struggling to process two major losses in her life, her dad Colin and her partner Matt, who both tragically died of heart attacks.
As she opens up for the first time about her battle to find happiness in the midst of grief, Jill is joining us in the studio to share her story. And it is a really sad story, for sure. But you also do this brilliant thing in the book, I feel, like if somebody was going through a similar thing and was right in the midst of all that grief and almost couldn't see the wood for the trees you chat to them like you're their friend, and you talk to them like, here's how we're going to navigate this.
Yeah, that's exactly what I wanted to do. I just wanted to help people. I wanted a book for people that were really struggling, with the loss of someone or something. And I wanted to say to them, this is what I did that helped me. And give them some context and give them some story about how I got there in the first place, but give them hope.
Yes.
It's really scary sometimes in the midst of grief. You have this loss of hope, and suddenly everything that seems to come into your future can feel quite despairing. And I just wanted to say to people, I get it, I know that feeling, but believe me, there's things that we can do that I think can help us get through it. And thankfully I'm now at a stage in my life where I can feel hope again and I can feel joy again. But that doesn't mean to say I don't have my dark days.
Not.
But I wanted it to be something that people could hold on to, like you say, like a friend.
It's like the tone.
And why now, though, Jill? Why did you suddenly want to write it?
Honestly, I was having a conversation with my agent and she said, have you got anything going on in your head? Is there anything you want to do? And I literally had just found myself saying the words that day, yes, I want to write a book. I had been thinking about it, but you know when you just say something one day and you go, turns out this is it. And then we set the wheels in motion and I pitched it to my book agent, and it was just one of those things where I do kind of follow my instinct quite a lot. And I thought, well, I've said the words out loud. Now I need to put it into practice, and I just need to write it.
Sometimes it's when you put it out in the world, it's like, and now I've said it, so now it is so.
Yeah, and it's scary, but it's good.
At the beginning of the book, you talk about losing your dad, and I think you were only 4 at the time. And from reading it, you very much get the impression that there was never closure for you. It was very kind of, grief was almost taboo and was hidden away, and not your mum was just trying to cope as best she could.
Yeah.
How did that affect you?
Yeah, I think that can happen. You know, it was 1979, it was the northeast of England. You know, we weren't sitting down with therapists, and we went into survival mode, and we went into, come on, let's get on with it, let's do. So we just became like a big family of doers. We were just busy and we were productive and we got on with things. So externally, everything looked really good. But I think internally, we're all really struggling, because sometimes you just really need to talk about how you feel. It's just as simple as that. And I think especially when you're little and you don't necessarily have the words, you need the guidance. You need someone to say, well, how are you feeling? Or maybe, you know, now with kids, they do a lot of art therapy, things like that. So I think what happened was I then became an adult. And I thought, wow, I've really skipped over a huge part of this process, and I'm going to now have to go back and try and pick it up. But what was really difficult was grieving somebody that I didn't know a lot about.
Yes.
Couldn't really remember as well.
Couldn't really remember. It was really hard. But it's there if you search for it.
Yes.
If you connect with it and you connect with the feeling, it's always there. But you have to allow yourself to sit in those uncomfortable feelings and just be okay with not being okay for a while.
Yeah.
So when you tragically lost Matt, was that the moment where you sort of had to go back and unpick what had happened to your dad? Because there were so many similarities in the way that it had happened.
Yeah, I just thought, OK, this is awful, but this is my chance now. I'm cracked open, I'm raw. Let's go and do all the work that I hadn't done with my dad, and let's grieve them both together, and let's see what I can learn from it, and let's see if it can, in some ways, does this make sense, set me free?
Yes,
you know,
of course it does.
So that's kind of what
there's a catharsis from doing it.
Yeah.
But going and doing that, I mean, from your family's perspective, you're being very personal and very open, but it's their grief as well. How did they find the process and you doing this? Were they nervous about you sort of delving and sharing some of these things, or did they actually get something from it as well?
Yeah, they were really generous and really good about it, and we sat down and we spoke about it. They all read the book before it went to print, so anything that they were uncomfortable with, but they weren't. We were all really aware that we kind of all separately and silently went off and did our grieving in different ways, and that there's never a wrong time to then come together and say, you know what, we all had the same dad, we all had the same experience, so let's share it. It's just sharing something, just feeling less alone, and there's just such great comfort in sitting down with somebody and just looking into their eyes and just telling them how you felt, or sharing memories. You know, my eldest sister shared some beautiful memories with me that she had about Dad, and she was like, you can have them now, and I was like, thank you, that's really nice, I will.
And they were memories that you hadn't heard before because you'd never sat down and talked about it?
No, and they weren't mine. There was some memories that she had of, like, playing Neil Sedaka and sitting in the car with them. And she was like, I want to give you these memories because I want to paint a bigger picture for you of what this man was like and what he meant to me. And so it's now like I have just a broader idea of who he was, and it makes me happy to have those memories.
Well, it's so funny because the minute you make those memories happy, because I know that your mum only had one picture of your dad, but there's a picture here of Matt and your little boy, Harvey, when he was little. And can you tell me what was going on in this picture?
Yeah, so we'd not long been going out, and we went for a Sunday roast in some bougie pub in central London, and we all ordered sticky toffee pudding.
Yeah.
And me and Matt, you know, tucked
right
into
in.
ours, and we had no problem finishing it. And Harvey was like, you know, I'm too full, I can't finish mine. And I was like, that's okay. And Matt said, well, I'll have the rest of yours, Harvey.
Yeah.
And he just looked at Matt, and then he looked at me, and he just spat into the dessert. And I was so shocked. That was like a total
Because it was quite a new relationship,
It was
wasn't
like,
it?
you know, you've got my mum, you're not going to take my pudding as well. And I was...
He was marking his territory.
I was shocked, yeah. But, you know,
monkey.
we laughed about it afterwards and, you know, they had a really good relationship, actually, but it was, yeah. Things like that, you know, they'll always be with me and they'll always stay with me, and it's, like... Once you've processed your pain, I think you can look back and remember your loved ones with a smile and with a lightness in your heart. And like I say, that doesn't mean to say that every day's a good day. It's certainly not. But I think grief work is something that maybe people don't realise, that you can actually do work to process it. You don't just have to think that you live with something and you don't know what to do with it. And in the book, I sort of explain the things that I did to help me through it.
We do phone-ins about grief occasionally with Deirdre, and it's always so painful to listen to somebody going through the loss, an immediate loss of a child potentially, or a partner, and the sense of bleakness. Because they can't feel like they're ever going to get to the point where you are, Jill, where you can look back and those memories actually bring them warmth and joy rather than pain and anguish. So what are some of those things that you would suggest people can do if they're watching today and they're struggling?
I mean, one of my mantras, especially on a day that I'm struggling, is get out of your head and into your body. And that's, for me, exercise. And that could take on any form for anyone that's listening. Whatever you do that stops you from living here in your head, because grief is so much about what ifs, shoulda, woulda, coulda. So just get out of your head and into your body just for 45 minutes or an hour and just allow your brain to slow down. And just allow those thoughts to just dissipate slightly. So that's one. Another one is I really practice gratitude now. Like I send a gratitude list to my friend, 2 of my friends every night, and they send me one back. And in the worst days after losing Matt, I just couldn't imagine being grateful for anything. And I would find myself having to write this list of 10 things, and I would, I had a nice cup of tea. Harvey seemed to have a nice day at school. And it was the tiniest things, but gratitude is like a muscle and you have to work it. And what you realise is when you work that muscle, suddenly there's just so much to be grateful for all the time.
Brilliant.
So there's two
really
little
simple things.
Really simple, they don't cost money.
No.
And it's just little things like that. But it is a practice and it is something that we have to do for ourselves.
Well, it's a brilliant book. It's practical. The tone is lovely. It's like having a friend who gives you the best advice. Her book is out now, A Life Reimagined. Jill Halfpenny. Well,
Thanks
so much.
Thank you.
Thank you.
Great. Thank you for visiting our This Morning YouTube channel. We upload new content every day, so go ahead and hit that subscribe button so you don't miss out, and we'll see you in the morning.
Now we've got an extraordinary story for you. Our next guest was diagnosed with cystic fibrosis at just 4 months old. She was told, or her parents were told, that she probably wouldn't make it into adulthood.
Well, fast forward to today, and Sophie Holmes has surpassed all expectations. Now 32, she's just set a new world record for running 36 marathons in 36 days.
I mean, it's simply ridiculous.
I mean, it's ridiculous.
Frankly,
and she looks like that, and
yes.
she's like, it's no big deal.
And when she runs, she always looks like that as well. I know Sophie, and I'm very, very proud to call her a friend.
Aww.
She's here alongside Dr. Zoe as well, who explained a little bit more about CF. Firstly, congratulations on the 36 in 36. It's an incredible feat. We'll come to that in a bit. I want to go back to when you got your diagnosis, or when your parents got the diagnosis as well. What was the implication for them? Was there CF in the family before that?
No, so they'd never even heard of it before. And so for them, because I was diagnosed at 4 months old, it must have felt like bringing up a baby to die. Like, you know, they got told I wouldn't make 16 years old, that I'd spend most of my life in hospital and would never achieve anything compared to like a normal person.
And so then what happened next? Because I know you weren't very well then, but around 19, was it?
Yeah, so growing up before then, I was very much like, I don't know what the problem is. Like, you know, I've had lots of medications, 80 tablets a day, all these things. But I was like, do I have CF? Because compared to what I was told.
Right.
And then when I was 19, due to a series of events, I did become really unwell, and the doctors were like, you know, it could be only a couple of years if it carries on at this rate.
Just got you sort of... You just quickly grazed over the amount of tablets you take a day, and this has always happened. I think so. I've done a lot of work with Cystic Fibrosis Trust. I've met some amazing people with CF and the people that do it. But trying to understand what the daily routine for someone with CF is really quite jaw-dropping. So just talk us through what that would be for a child with CF, Sophie, or even yourself now.
Yeah, so today is obviously very different, which we can touch on later. But before then, it would be get up in the morning, do physio, 2 or 3 nebulizers, tablets. And for a lot of people, this repeats at lunchtime and in the evening. So we're talking a good few hours a day without even starting your day or doing the things you've got to do. And every time, even now, I have to take digestive enzymes to digest my food, to absorb the food, to get what I need from it. So, you know, it's a hard life, but obviously I don't know any different. And I think that's the key. But for children growing up, you know, you don't really understand, but you do what you've got to do because you're kind of told if you don't, then there'll be serious implication.
But you kind of chose to have this incredibly kind of negative diagnosis, and you went, you know what? I'm not going to choose to live like. I'm going to set myself some challenges, and I'm going to do amazing things. And I think that's what's so incredible about you. What made you choose to do that? Because it's hard.
Oh yeah, don't get me wrong. Like I still have those days where I'm like, oh, can I do this? Or you know, no motivation. But for me, I've only got one shot.
Yeah.
And I wanted to do everything I could. And if, you know, what they were saying was true, I wanted to make the most of the years that I had to experience life. And so when I was told I may not have too long, I drew up a very long bucket list and despite all, went after it. And actually, it's the fitness and the training and everything like that I do believe has helped save my life.
Lockdown was extraordinary because we did some workouts together and you did a marathon on your front lawn.
Yes, it was part of an at-home Ironman.
At-home Ironman. By the way, your front lawn is probably about as wide as this carpet.
It was 50 metres and it was 842 laps.
Backwards and forwards.
Yep.
You on your bike on your turbo trainer in the front room.
Yep.
And the swimming?
Well, I do live on the sea, but unfortunately I didn't do the swim because obviously when lockdown happened, I got told not to leave my house.
Because you had to be shielding.
So I was shielding, didn't leave a one-bedroom flat for 17 weeks.
It's an extraordinary thing. So, OK, so look, we've established that you've got this incredible mental strength. But where did the idea for 36 and 36 come from?
Well, it actually came... Here we go. So it actually came in lockdown. So being told that I wouldn't make 30, I was like, right, I'm going to make 30 and I'm going to make a meal out of it because I'm going to enjoy and celebrate the fact, because I think most people get terrified to reach 30, but for me, I was like, no, it's a huge milestone and I'm going to go after it. And so I actually turned 30 in lockdown. And of course, typically I couldn't do anything about it, but the original idea was I'm going to run 30 marathons in 30 days and I'm going to finish on my 30th birthday and it's going to be a huge celebration because I'm alive and I'm healthy. But lockdown happened, so I thought, maybe not now, but it's going to happen. And then last year, a friend of mine was like, oh, come and run the Edinburgh Marathon. I was like, yeah, sure, why not? I've never been to really Edinburgh, so why not? And then I got into the London Marathon for the CF Trust. And I thought, hang on a minute, how many days are between these two races? And I thought, what's an extra few when you're going to be running that many?
Oh, my goodness.
So you
Nothing
start
can
in
stop
London,
you
finished in Edinburgh, it's 36 after 36. I mean, it's extraordinary, Zoe, listening to Sophie talk about this, because she makes it sound really easy.
Yes.
It does. I mean, it's unbelievable, isn't it?
Even if you had full lung capacity and you were healthy.
If you had no chronic illness whatsoever, to do one marathon, I think is an incredible achievement. To do 36 is exceptional. But for Sophie, with an underlying chronic disease, such as cystic fibrosis, you know, which one of the organs it affects is your lungs, it's outrageous, isn't it?
Yeah.
You know, I'm in absolute awe and admiration. And I think Sophie is such an incredible role model to other people who have chronic illnesses, and actually to all of us that don't, as to when you overcome something and put your mind to it, just what you can achieve. I think what's really interesting about what Sophie said there is that she said how this lifestyle has potentially saved her life. And we know that with CF, you know, exercise really must be part of the treatment for CF because it helps you in so many different ways. You know, it helps keep hold of your lung capacity. It helps clear that mucus. So one of the main symptoms of CF is that mucus secretions are thicker and therefore it's difficult for the body to release them, to get rid of them, and therefore they can harbour infection. So exercise, anything that gets your lungs working at their full capacity helps to clear those secretions. And I was chatting to Sophie earlier and she said even when she is unwell, she brings, you know, she really scales it back, but will still exercise because it can actually help alongside the physiotherapy that people with this condition need to have. So hopefully there'll be people out there
watching today will think, you know, I've been wrapped up in cotton wool my whole life because I have this illness, and now I'm going to go out there, I'm going to start off gradually, build it up slowly, but I'm going to take on this exercise because it can help the condition, it can help prolong life, it can help mental health, social health, every aspect of health. So.
And parents, there'll be parents watching as well that may have just had a diagnosis. To see you, Sophie, it's so inspiring for them. It's such a huge thing. Thank you for coming in. What's next?
Oh, do you know what? This is such a big question.
You're still working on it?
No, I know what's next. This is the problem, but it can't be for a while. And also, I think my friends, family and boyfriend would probably leave me. So I decided to go after it. But in a couple of years, there is something I want to go after partly because when I read about it, there's actually only 36 people who have finished it.
Wow. 36? Well, that sets you apart. It seems to fit.
Yeah.
Sophie, thank you for coming in.
Thank you.
It's brilliant to see you, and we'll continue to watch you, of course, and work with you. Oh, hello. Thank you for visiting our This Morning YouTube channel. We upload tons of new content every single day. So hit the subscribe button, like all the videos, and don't miss out. We'll see you in the morning.
It's the shocking sleep disorder that 70% of us will experience at some point. Parasomnia is the medical term for a range of sleep issues that cause you to have strange episodes whilst you sleep.
Yeah, but while some parasomnias can be relatively harmless, like sleep talking, for example, others can be so severe that the sleeper is unknowingly putting their life at risk every time they go to sleep.
Our next guest is someone who knows firsthand just how terrifying this can be. We're joined now by Sarah Taylor alongside sleep scientist Dr. Sophie Bostock. Good morning, ladies.
Morning,
Good morning. Now, we were chatting over the break, and some of the things, Sarah, where you wake up and you'll find a knife, or you'll have been chopping, or I mean, it's really scary stuff.
Absolutely terrifying. Obviously, I can see the funny side to it, but as living in it and not having that control over your own body, not knowing what you've done in the night, having no clue, it's really unsettling. It's almost feeling like you've been possessed or something. And I'll wake up in the morning, as you say, you know, finding a sharp knife on the chopping board, finding mud on my shoes is always terrifying as well.
So it means you've been out of the house.
Yeah.
When did it all start?
Yeah.
So when I was at university in my second year, we kept waking up to finding cupboard doors open and doors open through the entire house and in the bedrooms as well. And, you know, we're quite sciencey, but we joke, you know, as it goes, why is this happening? And it must have been a good 2 months before I woke up mid-walk and I was in the kitchen holding the cupboard door open, some bread in front of me. And it was just like this, you know, huge light bulb moment of, oh my gosh, it's me. And oh, what else have I done if I'm a sleepwalker? It was really quite a shocking moment. Of course, all my housemates were immediately like, oh, please don't walk in my room at night. You know? But yeah, it was quite a shocking way to find out.
But also that whole thing where you describe having muddy shoes or you've been out and about. I mean, there is a massive element of danger to this too, that you basically have no control over.
Completely. You know, I've woken up literally with my keys in the door, with my shoes on, and I don't know if I'm going out or coming in. I had one time, even when I'm not entirely asleep, so I woke up mid-walk once, and it's like full amnesia if you wake up mid-sleepwalking.
So you don't remember any of it?
Where I am, who I am, anything. So I just think I'm in this strange house. There's this strange man in my bed who was my boyfriend, and I honestly thought I'd been kidnapped. I didn't have a clue what was going on or where I was, so I army crawled out of there, you know, fearing for my safety, not wearing enough clothing, unfortunately. And I was out on the road, you know, all the lorries and trucks going by. And then it was like just a wave came over me of, oh no, this is where I live. That's my boyfriend. And luckily I caught the door just before I got locked out. But it's so strange to go from utter panic and amnesia to suddenly it all just came flooding back.
Fitting into place. But you've actually, at times, you've tried to lock yourself into the bedroom, haven't you? But you've somehow managed to evade all of those security measures.
Yeah. It's amazing how clever we can be when completely unconscious. So we put a lock very high up on the door because I'm quite short, thinking I can't reach it. But, you know, I must be moving furniture. We'll find sort of there's a bench in the room that has moved. So I'm obviously doing quite complex tasks to escape. And we've tried things to monitor it, like putting a pedometer on my ankle, but I'll just take it off. You know, there's nothing that can stop me.
Oh my goodness, you're ingenious. Even when you're asleep, you're ingenious. But there's also another element to it as well. You've got a little girl who's 5.
Yeah, and it's so scary.
So what if you went in and you picked up the baby or...?
Completely. I mean, I think the first 2 months, everyone's so sleep-deprived, you hardly sleep anyway.
Exactly, it's like sleepwalking through life.
So once I was a few months in and getting proper sleep and the walking was coming back, I was terrified. You know, was I going to try and feed her? Was I going to carry her? And then my body flicked to a different task. So it was a really, really terrifying time. My husband used to reassure me every night, you know, you've got strong motherly instincts, you won't do anything to hurt her. But obviously, the more you worry about it, I think the more likely anxiety, it seems to kind of feed in. The things I worry about seem to feed through into my sleepwalking sometimes.
And how about your husband? How does he cope? Because didn't you create a fort with all the...
Yeah.
That's
I literally, so what I do very odd things. Apparently I went dancing with Batman one night.
Wow.
How lovely.
Lucky me, eh? And stole the pillows from literally under his head and around the room, refused to give them back and built a pillow fort that apparently I crouched in for a good hour and a half and just refused to let him have that.
And is he trying to wake you up at that stage, or is he...
No, he knows not to wake me because it's that amnesia, it's that panic. It's a very scary thing. But what he'll sometimes do is just kind of tap the side of the bed, and that sometimes kind of signals me to walk back into bed. I'll still be sat wide open, you know, like I'm still through the motions, but at least I'll be contained. But he's actually got reduced hearing, so I usually don't wake him up. So he tends to
quite a
sleep
team, aren't you?
I know,
Between the
right?
two of you.
Perfect match, eh?
Wow.
But yeah, no, it's quite scary. And I'll do the morning routine a lot, you know, sort of hair, teeth, feeding the pets.
While you were asleep?
Yeah, my poor dentist, she hates the gum recession from the overbrushing, but I can't do anything about that. We've tried locking them away, but I just get the toothbrush out.
Sophie, it's fascinating hearing Sarah talk about it, and we're laughing.
It is, it's
but
funny,
also
but scary.
the sort of the absurdity of it, but it's also very worrying as well. How common is it?
For adults to sleepwalk, it's really quite unusual. I think to go through childhood and not have any episodes of a parasomnia, the most common being probably nightmares, but sleepwalking is probably the most common non-REM parasomnia. So we sleep in different stages. We start in a stage 1 light sleep, and then we come to stage 2, which is a bit deeper, and then there's stage 3, which is a very deep sleep where it's very hard to wake someone up. And then in a natural course of a night, you'll come back through something called REM, rapid eye movement sleep, which is often associated with dreaming. And in between sleep cycles, you'll often have a short period of wakefulness. Now, what happens in a parasomnia like Sarah's is that part of the brain is still in deep sleep. It's hanging on to deep sleep for dear life, but actually part of the brain is partially awake. So you've got, if you were to put a memory trace on Sarah's skull, you would actually see that she's in deep sleep, but just some visual awareness creeps in, but she doesn't have consciousness. She's not doing purposeful movements. She's not aware what's going on, and she won't probably have very much memory of what's going on. So it's interesting your point about when you were woken up during deep sleep, you know, you got quite afraid, and there's a bit of a myth around that we shouldn't wake up a sleepwalker. And the reason for that is actually for the safety of the person that wakes you up, because very often sleepwalkers can become quite aggressive. As you said, you thought you'd been kidnapped. And so if you can softly sort of propel them back to bed, that's probably the best thing, because usually they will fall back to sleep again afterwards.
And Dr. Sophie, is there anything that you can do, or is there anything that triggers it, or is there any things that Sarah should steer clear of?
Well, certainly Sarah's the expert. What we would say generally is that there's something which is disrupting the quality of your sleep. Now, for your brain to want to hang on to that deep sleep, it's probably been sleep deprived in some way. Now, sometimes that's just an irregular sleep pattern. Very often it's down to some kind of stress.
Something you're worrying about?
Something that's keeping you a little bit on edge. Sometimes it's alcohol, often medication, even things like coughs and cold medication that might contain a bit of caffeine can push you kind of over the edge. And I know you've had experiences where stress has definitely been a trigger.
Yeah, hugely. When I had my exams at uni, I would massively sleepwalk every night for a good sort of 2.5 months solid every night. It's exhausting. I wake up like I've been at the gym all night long. I'm often covered in bruises from knocking into things in my sleep. It drains so much out of you at a time where obviously there's a lot going on. Or like my wedding, you know, I had, my legs were covered in bruises on my wedding day because I'd sleepwalked like mad the 2 weeks leading up to it.
Oh, my goodness.
It was funny because we showed a little bit of footage as well, Sophie, of someone doing some press-ups. So someone's actually exercising while they're fast asleep. And I'm thinking, brilliant, you get your training done in the middle of the night.
People clean sometimes in their sleep, but also eating. And I think this is something you've experienced, it's sleep eating.
Unfortunately, I eat all the unhealthy things. I'm very envious of all these people who eat healthy and do exercise. No, it's always the unhealthy things. We'll find even like the block of cheese in the fridge has been gnawed on and little teeth marks. Or terribly, one day I had an awful day at work, so I brought a load of donuts for everyone at work the next day, and I sent my husband a very angry message saying, "You've taken the donuts for my colleagues," but he just replied saying, "Did you feel hungry at all when you woke up?" And I'd eaten 12 donuts and just eaten them all over the sink. I know.
Can you cure it? I mean, I don't know whether it's something you can cure, or can you appease the sleepwalking?
Usually, by concentrating on sleep hygiene. So you are protecting enough time for sleep, you're having really regular sleep patterns, sometimes some cognitive behavioural therapy to perhaps tackle the source of anxiety, depression, stress. Not always, and I know that Sarah's sort of been through the mill over the years with things that she's tried. Certainly with sleep eating, we tend to find that if you have regular eating patterns throughout the day, no strict dieting, that tends to be a trigger for the sleep eating. So for most people, they can bring it under control. It's relatively unusual that it will be as severe as this, fortunately.
OK. Well, thank you so much for joining us this morning, and thank you for being so open about it, because it is that thing where it's funny to a point and then it's terrifying.
Really concerning.
Yeah, absolutely. Thank you, Sarah.
Thanks, Sarah.
Thank you for visiting our This Morning YouTube channel. We upload new content every day, so go ahead and hit that subscribe button so you don't miss out, and we'll see you in the morning. Now, while it's well known that hot flushes, heart palpitations and difficulty sleeping are all physical symptoms of the menopause, many people don't realise the toll that hormonal changes can take on women's mental health.
While unknowingly going through perimenopause, Lindsay Martin rapidly descended into a very dark depression, attempting to take her own life before being sectioned under the Mental Health Act.
But after her GP husband, Kieran, decided she should try HRT, things quickly started to improve. They're joining us now to share the shocking story alongside renowned menopause expert, Dr. Louise Newson. Good morning to you all.
Good morning.
Lindsay, let's start with you. Can you take us back to the beginning, essentially, and set up the story for us?
So this is exactly 2 years ago now.
Oh, it's only 2 years?
Yeah, just 2 years ago. And I started off with anxiety. I'm not an anxious person.
No.
But this anxiety, it was about the simplest things, just daily chores. Would I get a parking space on the school run? What am I going to put on the food shop? Just really low-level things. But I recognised something had changed within me. So I got in touch with my GP practice.
Not your GP husband?
Not, well, he's my husband, but not my doctor.
OK.
So, but I obviously discussed it with Kieran, and it appeared as an anxiety disorder, and that's what I went
Can
expecting.
I just ask how old you were?
I was 45.
45 at the time.
Yeah. And I was placed on antidepressants, but that's what I expected. I was thinking it's an anxiety disorder, therefore that's what I would be given. But it rapidly spiralled. The anxiety got worse. I found I was getting heart palpitations. And within about 6 weeks, it was as if a light had been switched off in me. There was no joy. And you could have lined up my children with 1,000 other children. And I felt absolutely nothing.
Well, that was one of the things when I was reading about this case, was it was like you felt like you got no love inside you at all in the space of a very short period of time.
It was literally in a matter of weeks. I went from working, functioning, to just really, this joy had left. And shortly after this horrible feeling of lack of emotion, the intrusive thoughts came, and I constant thoughts of suicide, and I just didn't want to be here.
Kieran, I can't imagine what that's like to process as somebody's husband, but as a medical professional as well. It must have been so confusing.
It was, because obviously, as you say, I've had experience with this over 20 years of being a doctor. But to watch your wife go through it, and it was, I could see it in her eyes. It's like she'd gone. Literally, there was nothing there. And she was always open about the thoughts, and she was able to sort of tell me all the time that I want to kill myself, I don't want to be here. And she loves our kids, you know, and it's the same case now, but it just gone. As she said, she just had nothing in her that was worth carrying on for. And it was about trying to get her the help. And obviously, we went down the route and went down the mental health route, because at that point, that's what it seemed like.
You had to be sectioned.
Yeah, I had to be sectioned.
I mean, that's an extraordinarily extreme measure to take, but it was that bad.
Yeah, Kieran was having to watch me 24/7, and it was done for safety reasons.
Because you did try to attempt to take your own life.
Yeah, at this point, I'd certainly made it quite known that that's what was going to happen. But it was later down the line that I actually
attempted. Yeah. So then when you got sectioned, what happened next?
I was in an inpatient facility for, I think, 6 weeks. They tried different antidepressants, different combinations, and I was also given ECT.
Electric shock.
Which was the electroconvulsive therapy, which again, but that, you know, it's used in extreme cases. There is some really great evidence to say it will work with some mental health disorders, but nothing was really changing. And I was just, these intrusive thoughts, they were just 24/7. I can't explain it. It was like wading through treacle. Yeah. It's so hard to explain, like the mental torture.
So you're having all this treatment, really extreme electric shock treatments, antidepressants. When did somebody bring up the menopause or hormones?
They didn't. They didn't. This was it. It was said as a background comment. Maybe this could be her hormones, but that was it. It was never, this could be her hormones, therefore maybe there's an alternative route. It was being treated as a mental health disorder, therefore traditional mental health therapy.
So what happened then to step over that line from it just being something people were ignoring to actually going, well, let's give it a go?
Yeah, I came out on weekend leave and saw my children for the first time in 6 weeks, and it was like being a stranger in my own home. And then I tried to kill myself. And thankfully, it didn't go to plan. I did sustain some serious injuries. I fractured my spine and my pelvis in a few places and caused some real damage to my left foot. And I was then in a trauma orthopaedic ward. So I was out of the inpatient facility, and they were treating my physical symptoms, whereas my mental symptoms was, in fact, I was even worse then. I was sort of trapped in a physical situation as well as a mental situation.
So whose idea was it to try the HRT? Was it Kieran?
Yeah.
And what made you suddenly think, you know what, we've tried everything else. That's what it sounds like when you read it. Try it.
Because we'd done all the things that it seemed like it was.
Yeah.
So the mental health, all of the things that I thought.
So you've done a checklist. Let's rule everything out.
And I spoke to one of the psychiatrists and got a second opinion, and it was a female psychiatrist who listened. And she said, I don't know how to prescribe it or what to do, but let's give it a go. And she was on an orthopaedic ward, but they don't know how to do it. They asked the specialist, which is the gynaecologist, and they said, speak to a GP. So the doctor spoke to me, I told them what to do, and then they prescribed it just before she was discharged.
How quick was that turnaround, Lindsay, from when you started on the
The HRT, it was literally within 28 days. It was...
You were a completely different person.
It was like waking up from a nightmare.
From attempting suicide, 28 days later.
Yeah, and I was me again, just me, and it was horrifying to sort of relive what had happened, but at the same time, I was just so grateful that it was like, I'm back.
Louise, it's extraordinary to hear this from the sidelines. It's their lived experience, which is even more terrifying for them. So thankful that they found the answer. But how it could have gone on for so long with no one thinking, hey, does anyone think this could be? She's about the right sort of age.
Yeah, and it's not rare,
It's really sad, and it's the bit that worries me the most, because it's not rocket science, any of this, because we know our hormones work in our brains. Our brain produces estradiol, progesterone, testosterone, and levels decline, most commonly in the 40s. And the commonest symptoms of perimenopause and menopause are low mood, anxiety, brain fog, memory problems, poor sleep, brain disorder, really.
Yes.
And so, but we weren't trained. I had a meeting with a lot of the doctors I worked with last night, and we were all saying we've never seen this transformational effect because we've never tried. When we were doing psychiatry training, general practice training, we weren't taught, so you don't see the results.
Yeah.
But when you do, you want to scream from the rooftops, because every day I'm being confronted by people who do have very dark thoughts, and the number of women who are in mental hospitals under psychiatrists who aren't able to access HRT is staggering, not just in the UK, but globally.
I mean, you're a GP, Kieran. Since this experience, have you sort of suddenly started going, GPs need more training in what's happening with menopause and perimenopause?
I think it's also resources.
Right.
You know, as we all know, general practice, like the NHS is struggling, and we're in an election year, and they're all talking about it, but they need to put the money where their mouth is. And we need that support for the resources, for the training, to assist us in doing the job as well as we could do it.
Yeah.
But we need the people, we need the time.
And how are you feeling now? You look amazing.
Yeah, I feel great now. It was literally like a really awful period in my life, and it ended. And then I'm back to me, and I just think I had no idea that I was perimenopausal. Absolutely, it wasn't on my radar.
Yeah.
So it can't just be me.
No. It's not just you.
No, it isn't.
And that's the point, isn't it? Louise is going to be here a little bit later on with our phone-in on your menopause questions. We've been absolutely inundated with people who want some answers and want some help, just like you as well. So fingers crossed we can find that help. Thank you for sharing your story, though. It's great to meet both of you.
Thank you very much.
And Louise, we'll see you in just a bit. Oh, hello. Thank you for visiting our This Morning YouTube channel. We upload tons of new content every single day. So hit the subscribe button, like all the videos, and don't miss out. We'll see you in the morning.
Now, she underwent her first cosmetic procedure when she was just 17 years old, and in the years that have followed, Jessica Alves has spent £1 million morphing herself into a human Barbie doll.
But after more than 100 surgeries, is she finally ready to say goodbye to the operating table? She's joining us now to reveal why she's never felt more confident. Lovely to see you again.
Lovely to see you again. We've never met each other before.
We met, I think it was about 8 years ago on This Morning.
Yes,
we first met a long time ago.
Here I'm back. It's lovely to see you again and obviously to meet you.
Nice to meet you too.
We had a little chat when I was getting my makeup done.
did.
And I'm so happy to be here. So thanks for having me.
It's been quite 4 years for you, I think, Jessica, hasn't it, since you first decided you came out as trans?
As a woman.
Yeah, as a woman. And we were talking in there, you've spent over £1 million on your surgery, you've had over 100 procedures. Do you finally feel you are where you want to be physically?
It's been a very long journey. It's been very painful, very expensive, difficult to those around me as well, like my family and friends. Each time that I decided, OK, I need another surgery now. In the past, I felt like a dog trying to bite its own tail.
Right.
Why?
Up to the point that I reached a wall that I just can't live like this anymore. And then I did what I had to do, and here I am, very healthy and happy to tell you a story. It's not the end, obviously, but it is the end of my surgeries. I really don't need anything else. I had everything that I could possibly do under the sun. There's no space for anything else here. And I just want to live life. I'm 40 years old, and I've just been catching up with lost time, really, living the best life and trying to be inspirational also, using my social media, television shows like yours around the world, to be to inspire people and empower those. And I hope that also that a lot of people can learn from my experience as well.
You said you're 40 years old, that you aren't going to do any more surgeries. Do you now feel comfortable in your own skin? Because that's definitely something that I got as I got older. You become comfortable in your own skin.
I do, yes, I do. And even when I was getting my makeup done here today, thank you everybody who made me look pretty here this morning. Yeah, the guys here know me for quite a while. They say, Jessica, you're so much more calmer and in peace with yourself, and I am. I had a vocal cord surgery, and that was 4 years ago. I would like to get another one.
Okay.
Yeah,
so
it's not a
so you're not quite
it's
done
a
with the
functional surgery. It's not a beauty surgery. It's nothing related to beauty.
And why are you doing that,
I just don't
Jessica?
like my voice very much.
So you'd like it to be a little bit higher?
Yes, exactly.
More
so when I get asked to do radio shows, I always turn it down because I hate the sound of my voice.
Oh.
Okay.
So, yeah.
But do you feel now that you are in the right body for you? Have you always felt like...
Yes, I never felt... I even get emotional when I think deeply about it. I've never felt so happy in my life. And I just feel sorry that my life started so late, really. Obviously, I lived a great life before. I achieved so much. But when I got home in my intimacy, here in my apartment in London or in America or anywhere that I am, because I'm always traveling, I would feel so down and depressed, knowing that that the persona that I was projecting on television, that person that I was selling to the public, was a fake image. And now I just can't be more genuine than I am here right now. And
you're ready to look for love now as well.
Oh, I have been looking for love for a while.
Okay.
I know that you have some friends because I follow you on Instagram. So you better hook me up.
Your friends have better watch out.
Honestly.
Just need to point me in the right direction. Who would be your dream partner?
Fairly intelligent.
Yes.
Yes.
Hardworking.
Yes.
Adventurous. fun, not funny, fun.
Fun, not funny.
Fun to be around with.
Spontaneous.
And, no, I'm a little bit sapiosexual. Do you know what that means?
No.
Sapiosexual?
Cypersexual. Sapiosexual.
So basically, I'm attracted to intelligent minds.
So whatever the...
You can be as good looking as you are, painted in gold, but if you haven't got...
We need intelligent
She
minds.
speaks 5 languages.
Unfortunately, if you're after intelligent minds, you've ruled out all of my friends. Jessica, it's lovely to see you. We're glad that you are well and happy. And we will stay in touch so we can see how this adventure in love goes.
Thank you. Thank you very much. Lovely to see you too.
Thank you for visiting our This Morning YouTube channel. We upload new content every day. So go ahead and hit that subscribe button so you don't miss out. And we'll see you in the morning. Now, as we continue our Women's Health Week, we're discussing something that affects millions of women every year, urinary tract infections. But despite being so common, they're often still considered taboo.
Yeah, and if left untreated, UTIs can spread to your kidneys and cause permanent damage, which is exactly what happened to our next guest, presenter Cherry Healy. Joins us alongside senior urologist Jean McDonald. Good morning to both of you.
Good morning. Thank you.
Cherry, I'm aware of UTIs. I know that my wife has experienced them in the past. But your first experience of a UTI was when you were tiny.
Absolutely tiny. So some people, the reason UTIs are taboo is because they're associated with sex and hygiene after sex. So and when people say to me, because I've had chronic UTIs, they say, oh, is it, how's your hygiene? I think I was 3 when I first got them. I thought I was 6. And my first memory is at my old house where I grew up. And I thought I was 6. And I called my mum and I asked her, and she said, no. She said, you were 3.
3 years
I couldn't know. And she said, you actually had to go to hospital and you were put on a funny machine where you were turned upside down and you were filled with dye. And I mean, don't you love the drama? And Alison with the drama. And I said, I can't believe that. And that kind of also made sense as to why I'm so prone to them. But I remember having one when I was 6, and I've had them on and off throughout my life. My worst block of time was in my in my 30s after I had my 2 children. Obviously, something happened physiologically or hormonally that meant my body just couldn't get enough of them. Every month.
And what were the symptoms that you were experiencing then?
So the symptoms that there are lots of different symptoms, but the way it shows up in my body is wanting to pee, wanting to go to the loo. But then when you do go to the loo, it's really frustrating because it's only a couple of drops. You're like, come on! Take a book is my recommendation. And feeling sick, feeling a bit depressed, which is a funny one, but I've spoken to other women and they feel the same too. Feeling a bit down, feeling really uncomfortable. I spoke to the lady in your makeup room. She put it perfectly. She said, I want to take off my own skin, which is obviously very dramatic, but after a while, because it builds and it builds and it builds, that infection gets worse and worse, it gets to the point where it's actually unbearable. So this idea that because lots of women experience it, half of women have experienced a UTI and a quarter of women chronic UTI, so they're extremely common. I think there's a sense of, and this happens a lot with women's health, there's a sense of, oh God, just take a painkiller and go home, have a hot bath. They're serious, and if left untreated, you can end up getting sepsis and you can die. So I don't want to over-dramatise, but they should be taken more seriously. We should have an over-the-counter, non-antibiotic treatment. At the moment, there's not much you can do. You can just take antibiotics, which isn't good. You shouldn't take antibiotics. We all know that
continuously
you don't want to become immune. That's a real problem.
Yeah.
There are 3 over-the-counter solutions to erectile dysfunction, just over-the-counter, non-antibiotic. There's not a single one for UTIs, and that just says there's a real gender health gap in things that are common for women.
And they can kind of strike anywhere, anytime, any place. You had one particular occasion where it was so dramatic and you got so ill, didn't you?
Well, it was my own fault, Kat. I was my own doing. So I was filming, and on the Wednesday evening of filming, I thought, I
think I might be getting...
Woke up on Thursday, yes, it's definitely there. But I was a bridesmaid. I was actually maid of honour at one of my best friends' wedding, and I thought, I was going straight from filming to her wedding in the countryside, in the middle of nowhere. There's no way I could get to a doctor.
You couldn't get something.
So I just was drinking cranberry juice, taking painkillers, which don't work. Painkillers don't work for UTIs. And I could feel my body getting sicker and sicker. I went through the Friday night celebrations, smiling like... and then by Saturday at the wedding, I just felt horrendous. And my partner, who then joined, looked at me and said, you look really bad. I had a blanket wrapped around me for the whole wedding pretty much because I was shaking uncontrollably because there was a fever. What had happened is the UTI, because I also thought maybe it's getting better.
Right, it was improving.
And what had happened is it had moved up to my kidneys.
Oh, no.
So then I got really, really, really sick, and I just went into a dark room and I sat there with a headache, and that's when the infection really set in. Went to A&E the next day, and they just couldn't work out what was going on. And I underplayed UTIs so much because I just thought everyone got them. I didn't even tell them I'd had one because I didn't think that was it, because I thought it had gone.
You thought it was something else at that point?
It's only when they going to do a lumbar puncture on me to find out, because they realised I was really unwell. And they turned me over onto my tummy, and she pushed my back, and I went, ow! And she said, oh.
And it's actually scarred your kidneys.
Yeah, she said, I think it's in your kidneys. And I was in hospital for 5 days.
Oh, Cherry.
On an IV antibiotics. And it scarred my kidneys. And that's what happens if you don't listen to your body.
Yeah. Jean, I imagine you hearing Cherry talk about it like that. It's something you've heard over and over again from women who have been through this. Can you just describe what the UTI is? And is there a reason that certain people are more susceptible? Cherry has been getting them since she was 3.
Right. Well, a urinary tract infection is an infection in the bladder. And basically what happens, you may just suddenly get up, usually on a Friday or a Saturday, because
it's always... Why?
Yes.
Why?
I know, it always is a day that you can't go to the doctor. And then you're passing urine quite frequently.
Right.
You may feel a bit under the weather. In a sort of situation, you may sort of have blood in the urine. Or urine smells a bit off, and you're rushing to the toilet, but you're actually not passing much. And you get these symptoms, and then it's important to drink lots of fluids. And then what happens then is that you may go to the chemist or, and sort of ask for something. But there are different things that one can actually use and, try to use, like D-mannose, for example, and cranberry, but...
So that works, is it? Cranberry juice works?
It's different. It works with different people.
Right, OK.
Because, as you know, everybody is different, and some bodies react to one thing and others another one.
With cranberry.
What
delicious, though.
What does the cranberry juice do? Does it change the acid level?
The acidity, yes, in the urine.
OK.
And then it prevents the bacteria from actually binding to the bladder.
OK.
Jean, is there a reason why Cherry would be more susceptible than, any other women in the family, potentially?
The thing is, she says she had urinary tract infections from when she was quite young.
Right.
So you think whether or not she had something called vesico-ureteric reflux. And that is when, because urine should be coming from the kidney down to the bladder.
Yeah.
And if the opening, when it comes in, it's bigger than it should be, urine can reflux up into the kidney. And that can happen usually as the child grows up, then the ureter sort of lengthens, so to speak, and it may not be as bad as they go. But, she has a family history of this, so that's another thing. Yeah. And it would make you more prone to have infections later in life as well, especially,
Absolutely.
Is there anything people can do to kind of try and prevent them from happening?
Right. There are lots of different things. One can make sure hygiene is very important. So you wipe from the front to the back, right? Yeah. Because, what happens in ladies, and the reason that ladies get urinary tract infections is because the whole of that perineal area, where the rectum is, the vagina, and the urethra, always has bacteria, no matter how clean you are.
Yeah.
And the bacteria that cause a urinary tract infection are bacteria that live in your gut. So taking things like probiotics can help. Having adequate hydration, making sure that you're drinking enough fluids. Usually some people complain after sexual intercourse, especially if you use sort of these spermicidal agents, that as well is one of the things that can cause you to get urinary tract infection.
Is there a point, at what point should you go to your GP, though? Because clearly Cherry can deal with it and copes with it on a day-to-day basis and works it through and knows your body very well.
I'm never very far away from antibiotics.
Yeah, you've always got something.
When would you say, right, now you need to see your GP?
If you're getting pain, if you get blood in the urine and you've tried sort of the measures, the normal measures, and it's not working, and even antibiotics for 3 days and it's not working, then you know that something quite serious is happening, and then it can actually go up to the kidneys, and then you can get pyelonephritis, and which can be very, very serious. Exactly.
Okay. So 3 days, and then
I was just so, and Jay has got in touch saying having a UTI was literally one of the worst things that happened to me. I remember thinking I was going to die because it was so severe. I couldn't breathe, my head was spinning, my back was hurting, and I kept passing out. And that sounds like where you were when you ended up in A&E.
I mean, I've met so many people who say when they get them, they sleep naked in the bath because it's just the only place they have comfort. The FDA have just approved an oral vaccine which will stop you getting utilised for up to 10 years.
Wow.
But that's in America, not here. But we need a lot more research for non-antibiotic solutions for something that affects so many women.
Yes, absolutely.
This is another message we have from a viewer. UTI is horrific. I had 7 already since January. No bacteria, so no antibiotics. Absolutely excruciating pain. Thank you this morning for covering it. Thank you, Cherry, for being courageous enough to come and share something so personal but so important as well. It's really, really important that you do. And Jean, thank you for joining us.
Thank you very much. Thank you for visiting our This Morning YouTube channel. We upload new content every day, so go ahead and hit that subscribe button so you don't miss out, and we'll see you in the morning. Our next guest has quite the unique diet. For the last 5 years, he's been enjoying meals consisting of raw spleens, kidneys, and even raw chicken.
Yeah, that's right. You heard it right. Despite doctors' warnings, he claims his controversial diet has made him feel even better than ever. Gives him the urge to howl like a wolf.
Well, let's dive into this wild story and find out why. Weston Rowe joins us now live from his home in Nebraska. And Dr. Zoe is with us here around the table. Morning to you both. Good morning. Just a quick reminder, if you want to have your say, you can scan the QR code on the screen right now. Good morning, Weston. Thank you so much. I know it's about 5:24 in the morning there, so thank you for getting up nice and early for us.
Yeah, you're welcome. Good morning, and thanks for having me on. I appreciate it.
Good morning. So tell us, how much meat do you consume in a week? Is it every single meal?
Yeah, we eat raw meat every meal here, and I do about 2 pounds a day, so about, I'd say, 14 pounds a week.
Right, and how long have you been doing this for, Weston? And what was the catalyst for it?
Well, it's been about, I would say, 5.5 years. It'll be 6 years here in August. And what happened was I just kind of started having some health issues late in my 20s and early 30s, and skin problems and brain fog and fatigue and just a lot of issues that people face today. And I decided to take matters in my own hands and go ahead and address it with diet, because I knew that eating good food always made me feel better. And so I just kind of took one step at a time and basically ended up here.
Eating good food undoubtedly is going to make you feel better, but there's a big difference from eating sort of a broad range diet of fruit and vegetables and protein to then just sticking with the meat and then raw meat at that. How did you decide that was going to be the route that you went down?
Yeah, it was like a path that I followed, and a lot of people end up here. It started with going gluten-free. That's a big movement. People cut out bread and grains and things like that. And I noticed a huge increase in my health by just cutting out gluten.
Yeah.
So I may have had some kind of non-celiac gluten intolerance or celiac disease or something going on. So I decided to take it a step further and cut out all carbohydrates. And so then they call that the carnivore diet. And I was cooking just meat and eggs and eating bacon and things like that all day long for about a month. And then I discovered the raw meat diet, which people claim makes you feel even better. So then I just stopped cooking my food and I felt even better right away. So I just ended up here and I just never stopped doing it.
So, Weston, obviously, we were actually talking about it in the break before we came to you, and we were talking about eating sushi and eating raw steak and steak tartare and things like that. We've all definitely done that, but you eat everything. What was it like the first time, I don't know, you ate chicken or something different? What was the kind of the taste like, and also just even the feeling?
The mental experience of doing that as well.
Yeah, well, I guess the first thing I ever tried was a steak, like a ribeye steak. I guess that's probably the easiest thing to start out with. Most people can usually handle that. And wasn't too bad, really. Like, I had a little bit of I guess, kind of a gag reflex because it was such a new texture and flavor. It took a while for my palate to adjust to just the bland taste, because we're so used to eating, salty, sugary foods our whole life. When we go back to what I believe is our natural diet, it can be quite a shock. So it took me a while to adjust to the flavors. And I actually gagged for a long time, but I knew it was the healthiest diet I could eat, and eventually got to the point to where it's very interesting. I actually really enjoy the flavors now.
And it's, as Kat was saying, it's about coming up to 5:30 in the morning, so it's breakfast time. The step from beef is one thing, but chicken is something else that you will eat raw. Was that a hard step to overcome, to actually take? Because we're told so often that you must cook chicken. Chicken can be really, really dangerous if it is eaten raw.
Yeah, that's a common thing that a lot of people believe, and I find it actually kind of funny, because I've eaten like hundreds of raw chickens over the last 5 years, and I've never gotten what people call salmonella poisoning. So I think there's a lot more going on to the germ theory, that germs cause disease, and you can get sick from eating raw meat. I think there's a lot more going on there than we're being taught, and
right.
I think I'm on proof of that.
Okay. Yeah, I think you've got some chicken there, haven't you? You're going to eat some chicken for us for breakfast?
Sure, yeah. I got this is a local raw pastured chicken breast, or this is a chicken leg. This is from a local farmer. I get everything from local farmers, and it's really nothing. It's pretty bland. It's not too bad.
Wow. So while you chow down on that for a second,
what's the texture like, Wes? Can I just ask, what's the texture like of that?
Well, I mean, it's just squishy and a little bit slimy.
It's like eating chicken. Dr. Zoe's here in the studio. Yeah. Now, it's an interesting point, isn't it? He thinks there's lots of things going on about germ theory and with regards to what's in there. We can't recommend everybody or anybody goes and eats raw chicken, right?
No. Well, I would advise definitely not doing that. I mean, there's some things Weston said there. He's getting it from a local farmer. It's locally sourced. His farmer knows he's eating it raw. So I'm sure, there are certain things like that. If it's stored properly and looked after, you can reduce the risk. But we also know that in America, 48 million people every year end up getting foodborne illnesses. So things like salmonella, campylobacter, clostridium, hepatitis A, worms, especially with pork. There's a really nasty type of worm infection you can get from raw pork that can then go to your brain, into your eyes. So there are, we know, lots of infectious diseases that we see. I've seen patients who've had it, and there are certain things you can do to reduce the risk of that. But, we've all had a steak cooked rare.
Yeah,
I have.
That was what we were talking about.
And with red meat, these bacteria, these pathogens only tend to survive on the outside, which is why it usually has to be seared all the way around. The difference with chicken is that those pathogens can travel all the way through the flesh, which is why it has to be thoroughly cooked. The same with mincemeat. You have to thoroughly cook it.
We're just going, what's that? Is that a kidney of some sort?
Is it kidney or is it liver?
Grass-fed beef liver.
Grass-fed beef liver. Okay.
So, liver, very high in nutrients. It's something that some people may like to eat cooked. I wouldn't recommend eating it raw. Important point that people who are pregnant should not consume liver because it has toxic levels of vitamin A.
What about that point that Weston makes, that actually it's improved his health, he feels euphoric when he's eating it, and actually it's given him energy, and it's cleared the brain fog, and he feels all around much better.
Well, I think one of my other concerns about a diet that is 99% meat is nutritional deficiencies as well. There are lots of nutrients that we need as human beings that we can't get from animal sources, but I'm sure something Weston and I would very much agree on is that the typical modern day diet in the UK and in the US is far too much ultra-processed foods.
Yes.
I think in the US, it makes up about 70% now of a person's typical diet. And that is toxic to us. It's not good for us. And one way to get rid of all those processed foods is to do a carnivore diet. I don't necessarily think it's the healthiest way. Some people go vegan and cut out all ultra-processed foods and can be very healthy as well. We are omnivores, so we are designed to be capable of eating both meat and plant foods, and you can cut out ultra-processed foods and do that, which I would pose as likely to be the healthiest option.
Weston, do you miss anything? Are you missing any food that you don't no longer eat? Ice cream, things like that?
Well, actually, we make raw ice cream here at the house. So we get raw milk and raw cream and raw eggs and raw honey, and we mix it all up and we make our own ice cream here. So we try to, you know, sneak in little healthy snacks there.
And you've managed to get your girlfriend to do this diet as well with you, Weston, correct?
Yeah, and she's now my wife. And we have a baby.
Congratulations.
Yeah, she does it. She does it too. We all eat it. And her health has never been better too. It's been such a fun journey.
And then if you have a young family as well, what will you do with the young family?
Oh, they're going to be eating with us as well, for sure. We're all going to be eating that way, definitely.
It's absolutely fascinating. Weston, thank you for joining us. I hope you've enjoyed your breakfast. It was extraordinary watching you eat it. I'm going to imagine what the flavour was like. And we should reiterate, particularly, Zoe, with the chicken.
Yes, and I think for anybody who, if they do go on to have a family during pregnancy, this is not safe. And for children as well, they can't get all the nutrients they need from animal products alone.
We do not recommend that you eat raw chicken. Fascinating stuff. Thank you, Weston.
Thanks, Weston.
Zoe, thank you.
Thank you.
Oh, hello. Thank you for visiting our This Morning YouTube channel. We upload tons of new content every single day. So hit the subscribe button, like all the videos, and don't miss out. We'll see you in the morning.
According to new research, couples in their 60s are divorcing in their droves in what is being branded the silver splitter revolution.
Wow. We're joined now by one woman who's proving your love life doesn't have to end after you've called it quits.
Tina Pembleton, who's 69 years old, has made it her mission to find love before she hits 70, and she's been documenting it on social media.
You're going to love Tina.
I'm 69 and I'm dating. I'm not looking for a man I can just do puzzles with or sit by the fire. I want to be on fire. That was me 50 years ago. I was insecure. And look at me now. 69, little bit of a belly because I love my food. You like me or you leave me. I think I've been catfished by a plastic surgeon. You can still have a friend with benefits at my age. Why can't men make a little bit of an effort? I worry that maybe I'm too fiery, too loud. I'll only get louder as my hearing becomes a little bit more impaired. I got stood up by an Italian guy this week. There was no way I was going to rearrange. Ciao, bello. After all these years, I still don't understand what goes on in a man's head.
What is going on in a man's head,
Don't ask me.
Shepherd?
I've got no idea.
What is going on?
Italian will be... I mean, who's laughing now, Tina?
Well, unfortunately, you don't know what I was saying because it just said I was having, you know, bit of a sort of rant in Italian, but I was actually swearing at him.
Well done, nice.
Good morning.
Good morning.
Lovely to meet you.
You are just infectious. You are a ray of sunshine. We love the TikTok. Don't we?
Loving the TikTok.
69 and I'm dating. So let's start with, why did you start doing this?
Because I was a little fed up with all the dating apps. I haven't really had that much success. Otherwise, I wouldn't still be trying to find someone before I'm 70, and I've only got a few months left.
You've not always been, Tina, you've not always been single, though, have you? You were very happily married for...
over 30 years.
Over 30 years. Then you and your husband decided, you know, you just drifted apart, right?
We kind of separated about 7 years ago, and... You know, I just wanted more adventure in my life, new things, and wanted to come back and live in London. So here I am.
So you started using the dating apps?
Only a few years ago.
Just a few years ago. What's that experience been like?
Well, I mean, I wouldn't stop doing it because now I'm just swiping has become a full-time job. but I just think that really, if it was possible, probably still the best thing is to meet someone organically.
Right, okay.
If you could. I mean, I didn't grow up with dating apps, with texting.
No.
I didn't grow up with this, and I still find texting awful.
Yeah. It's a bit weird, isn't it? And all that kind of trying to decipher what someone's actually saying underneath it all.
But sometimes they don't say anything. They're so monosyllabic, or they talk about the weather. And I mean, you know, you can't get excited. So I'm looking at their face to start with. But sometimes it's not only that. You might sort of see what they do, see how they... Sometimes you can listen to their voices, which is, you know, tells a few things sometimes. But even when I do end up texting. I try to get to meet them as soon as I can.
Yes.
You like to be face to face.
So you know
immediately.
Yeah,
Immediately.
you know
Like, no, why don't we meet for a drink? You know, do you live in London?
Yeah. So who's your ideal man?
What are your requirements?
Come on,
that's a good
Ben. Maybe 10 years on.
Wow.
I'm not a cougar, by the way. I mean, a joke about this.
I think you might be.
No.
So what we're saying is the requirements you have when you're going through, because some of our viewers will be thinking, you know, at similar age to you, they're keen to try something like this. What are the requirements that you need in the man that you're going to be dating?
I think it's not just drop dead good looks, you know. I mean,
you know.
I don't want... No, there's got to be charisma.
Right.
I want a man to be international.
Oh.
Yeah, it has to be. I'm a very international person. I have travelled a lot in my life. And now I just don't want to sit by the fire with someone with a pipe and slippers. I want someone to light my fire, you know?
Yes. Right, and let's talk about age, because, I mean, we may have some eligible
Suitors.
bachelors watching today that might be interested. What sort of ages are we looking at?
Well, I wouldn't go lower than probably...
25?
No, 55.
55, okay.
55.
So you go 55?
When I, you know, on my dating apps, I go like 55 to 70, early 70s.
That's a good window.
I've got some friends who are on dating apps,
Oh, yeah.
and they've also got some horror stories too of certain things that have happened, and it's been going really well, and then all of a sudden, anything like that happened to you?
I wouldn't call them horror stories.
But?
I'd just call them disappointing stories.
Right.
I mean, my first date didn't even turn up. So
And that was your first one?
Now, that could have put me off forever.
Yes.
But it didn't. I thought, well, I'm just going to get used to this. Then I had a date where the picture wasn't bad. We said we'd meet for a tea or a coffee in the afternoon. I hadn't started dating people in the evening at that point. I thought it was safer to go in the daytime. Yeah. And when I met him, I could see the picture was at least 15 years old.
Right.
And we had chatted a little bit on the phone, because I like to do that first.
Yeah.
Just to get a feel. But when I met, I had absolutely nothing to say to him.
Oh,
and that's unusual for me.
Yeah.
I'm quite vocal.
We can tell.
But anyway, after a few minutes, we were talking and we had nothing in common. He said his favourite meal was steak and chips, and mine is fusion fish. Spicier than ever. So
sometimes the spice of life,
yeah,
perhaps?
exactly. So next to this coffee shop was a fish shop. And I suddenly thought, how am I going to get away from this guy? I said, look, I've got to go and buy some fish because they're going to close soon.
Right.
Not thinking...
Did you do a run, Tina?
No. He got up with me, paid for the tea.
Nice.
He said he couldn't bear the smell of fish. And he walked into the fish shop with me.
Oh, so
he quite liked
followed
you then.
He was...
So I suddenly
He was smitten.
So I said to him, well, it was really nice meeting you.
Yeah.
And he said, well, is that it? Aren't we going to see each other again?
Oh, wow.
And I said, well, to be honest, I don't think we've got much in common.
Did you do all this in the shop?
Yes.
You let him down in the fish shop?
In the fish shop. That's why he doesn't like the smell of fish anymore.
Heartbreak.
You've got kids, though. It's your son that encouraged the TikToks,
Yes,
which we absolutely love, and it's
Yes.
gone viral. Some of your videos have been watched over a couple of million times. What do your kids make of this, Tina, this newfound digital dating fame?
Well, I mean, you know, my other son is married with young children, so he doesn't get as active. Josh is very protective of me, actually, and he, if I go out, he's like, it's a bit of a role reversal. He's like waiting up for me, like, you're late, or where have you been? Or if I'm going out in the evening, he'll try and check where I'm going exactly in case, you know, anything happens. But I'm pretty safe when I go out. I always meet in busy places, buzzy places. You know, I don't go and hide with all the old people in a bingo hall or something, you know.
I think Tina.
Fish shop is
we need to
where
get
it's at.
Tina to come back and do some dating advice for some of our viewers.
Sure, would
some
you do that
phone-ins
for
with
us?
Tina.
I'd love to.
Yes.
I'd
and
love
maybe we
to.
can find some dates for Tina to go out on as well. Is that there's Josh over there?
We know her type. That's the thing. We know her type now.
Lovely. Tina, thank you for coming in. And as Kat says, bring a ray of sunshine and joy to us all as well. Keep being you.
Thank you. Thank you very much.
Thank you for visiting our This Morning YouTube channel. We upload new content every day. So go ahead and hit that subscribe button so you don't miss out. And we'll see you in the morning.
Now, the last night, ITV's BAFTA-winning show, Long Lost Family, returned to our screens. This time focusing on people who were quite literally born without a trace.
And in tonight's episode, we'll hear the story of Rachel MacArthur, who shortly after birth in 1969 was abandoned in a long-stay car park at London's Euston Station and became known as the Euston Baby.
And now, more than 50 years later, Rachel contacted the long-lost family team to try and get some of those answers she's been so desperately looking for. She joins us now. Lovely to see you this morning, Rachel.
Thank you.
Kat and I have watched this episode of Long Lost Family, and it is truly remarkable. I wonder how you feel about the fact that people are finally going to get to see it, because you must have filmed it a while back.
Yeah, it wasn't too long ago. It's just such an amazing story to find out there were so many of us as well. You know, we're one of 12. But I think the thing that meant the most, that I had 2 full siblings. So that meant such a lot to me as well.
We'll come to the siblings, because the siblings thing is just one of the most exciting bits of it, of course.
Lovely.
But tell us about your story. It's just one of those things. It's like a fairy tale, really, isn't it? We talk about babies being left at stations.
Call them foundlings.
Exactly.
Yeah.
But that was actually your existence.
Yes, it was. So I think I was around 6 weeks old. And I got taken into care after I'd been found in the station. And at the time, my mum, my adoptive mum, she was running a children's home, and she had one space, and they phoned her and said, "Have you heard of the Euston Baby? Would you like to come and meet her?" And that was it. My mum fell in love with me, and she adopted me after 12 months. We moved up to the Midlands, and I had an idyllic childhood, really. It was perfect. Little country village, ran the post office there. So it probably wasn't till I was about 7 or 8 that my mum had gradually introduced me into Paddington Bear.
Yeah. Phyllis, she did, didn't she? Because he was left at a train station.
And she told me one evening, I can still remember it, and she said that I'm just like Paddington Bear. And he was left in the station, and so were you. And I think at such a young age, you don't really realise what that meant until I got a bit older. And I think I'd questioned my brother, actually, rather than my mother. Do you have to be born to a mother, or are you just adopted? So I think there was a bit of a process as I was growing up, but it probably didn't really affect me until I was in my teens, when, you know, you understand, you know, what's happened to you, what the circumstances, you don't know what they were, and that doesn't sit well on your mind, especially when you're a teenager.
Yeah, of course.
So, but I had the support of my parents, the support of my family, and, you know, as I've gone on in life, I've been quite resentful to my birth mother. Didn't know her circumstances. And I think it probably wasn't until I'd given birth to my son, who's now 14, that I actually kind of came to terms a bit with how horrible it must have been to carry a baby for 9 months and then keep it for 6 weeks and then give it away, leave it. And that was it. I understand that she told nobody about my existence, so...
We know that now, don't we, of course, since you've been through the programme. But it took the birth of your son for you to sort of realise how painful that must have been.
Yeah, I sort of
how difficult.
came to terms with it, and I stopped being so angry at her and resentful. It's funny you mentioned the word foundling, because there was a series called Foundlings, and I used to watch that, and I used to get really angry watching it. Probably, you know, because it's so premeditated to leave a baby somewhere. It still goes on now.
Well, that was the moment when you went to Euston Station and you actually stood there and had that moment, and that moment of realisation of, you know, she was there with you 6 weeks, and she'd made the decision that was what she was going to do, and she thought that was the best. So as you've kind of started to piece together the story, what did you find out about your birth mother? And
she hadn't had a very good upbringing. No. I think she'd grown up in care with her. She was one of 4, so they all grew up in care. She had my older sister Eileen when she was 14, and then she's had me when she was 15, and we believe that she was living on the streets.
Right.
With Eileen and myself.
Yeah.
So she then went on to have another child
a
year later. and that was Shane. And he was taken straight to social services, I believe, in Ireland.
Yeah.
And was adopted.
So you suddenly find out about your mum, but crucially, you find out about your siblings.
Yeah.
You've got a sister and a brother.
Yeah.
And then there's more siblings as well along the way that are half brothers or sisters or connected
Yeah.
in some way. But you have these two brothers. What was that moment like when they told you had siblings?
I couldn't believe it. Just couldn't believe it. I always wanted a big family. And, you know, part of my thing, did I have more siblings? Was she still alive? Sadly, she's not. I'm not going to be able to meet her, but to find out that I have such a big family, and of course the age we are, where they've all had kids themselves.
So there's extended
it's
nieces and nephews,
lots to meet.
When you met, you had like an instantaneous kind of connection. I think we've got Eileen down the line now.
Because she's in Canada.
Good morning, Eileen. Good morning. Thank you so much for staying awake for us.
No problem.
Thank you. So how was this moment for you? Because it's an incredible moment in the show where you both walk into this room together and you hold and hold and hold each other and kind of don't let go.
It was amazing, actually, when I first found out about her, which was in November of last year. And I was told that I have a sister, but at first they thought I was just a half-sister, and did the DNA and found out we were full-blood sisters. And that was pretty amazing. So, when I met her, it was just, first I saw a picture of her, and we do look alike, so that was kind of neat. And when I met her, it was, I always felt like there was something missing in my life. And I at first thought it was Shane when I was told about Shane. That wasn't quite it. And then when I met Rachel, it just seemed like that was it. She was the one I was missing.
Yeah.
And didn't know about it, but...
Had your mum ever mentioned anything to you over the years, Eileen?
Nothing at all. So, she was... I think it was 2011 that I found out about Shane. And that was because Shane was trying to get a hold of our family, get a hold of us.
Yeah.
She felt like she was forced to tell me, and but nobody knew, not my aunt or anybody.
And did Rachel look like your mum when you saw her first time?
She does look like my mom. She's got similar eyes to my mom, sure.
And they look so similar too.
Looking at the two of you as well, it's just amazing. I imagine you had so many questions for Rachel when you first met.
Yeah, absolutely, loads. You know, when you're a foundling, it's one big thing that nobody looks like you. So it was just amazing to be able to look at, my sister and pictures and see people that look like me. It was just such a big thing for me.
And the most amazing thing now is you've got each other forever now.
Yeah.
And that connection will always now be there.
Yeah. Like I say, it's built. I always had that connection initially, but it's got stronger and stronger.
Well, look, we are thrilled that you came in to share your story. It's
delighted for you.
Thank you, Rachel. Eileen, thank you for staying up. You can go to bed now. I think it's about 2 or 3 o'clock in the morning. But it's lovely to see the two sisters side by side as well.
And you can see the story tonight at 9 o'clock on ITV1. Thank you for visiting our This Morning YouTube channel. We upload new content every day, so go ahead and hit that subscribe button so you don't miss out. And we'll see you in the morning. Ahead of a new documentary, Detective Constable Maddie Henner, who was lead on the case, joins us alongside Emil's ex-partner, Nicolene Shepherd. Good morning to you guys. Good morning. Thank you so much for being here. Tell me what you thought when you first heard about this case, Marie.
So the first time I heard about this case, I was at work on CID in Salisbury. And we had a phone call into the office. It had been a very busy day. It was a bank holiday Monday. It had been a very busy day and a phone call came in. And it was from the chief instructor at Netheravon Airfield where the accident had happened. And he phoned up to say that there'd been an incident the day before and he had some doubts about it. He was unsure about it and thought that police ought to be involved.
So initially, everyone thought it was just a tragic accident, that the parachute and the reserve hadn't opened and that she had crashed to ground. Miraculously, she did survive, but it was only when suddenly they looked at the parachute, they thought, hold on, this doesn't look like it was an accident, this has been tampered with.
Yes, as you say, miraculously she survived.
It's incredible.
Somebody was certainly looking after her that day. I think right from the start, the chief instructor had some doubts.
Suspicion, right.
He thought something was not right about it, hence he'd called in police. Yeah.
Right. And did Victoria have any thoughts that it might be her husband at all? When you first started talking to her, what did she think had happened?
I think you'd probably have to ask her, but I think she realised that this couldn't have happened accidentally when we explained the technical side of why the parachute had failed. But I'm not sure that she thought it was her husband at that point.
When did Emile become the suspect, the main suspect?
So, about a week and a half after the incident, I received a phone call at work from a friend of Victoria's, and she said that she had some concerns.
And she was a doctor too, wasn't she?
She was,
yeah,
yes,
I remember.
in the military, yes.
Yeah.
She said she had some concerns about their relationship and that it wasn't quite the perfect relationship that it appeared from, to the outside world. And she asked if she could talk to me about it. So I took a statement from her about 2 weeks later, at which point we thought, yeah, he's going to have to be spoken to officially.
And so then you spoke to him, you interviewed him, and straight away, your hairs kind of went up on the back of you. There was a certain level of intuition that you kind of listened to, and you were like, I'm not sure about this guy.
Yes. It's funny, when you deal with people all the time as a police officer, you learn to read people.
Very much so.
And I think he just made me very uncomfortable right from the get-go.
In what way?
He was supremely confident. When you've been arrested on suspicion of attempting to murder your partner, to be that supremely confident did not feel right.
It's interesting, Nicoline, because you met Emile many, many years before, and you sort of were childhood sweethearts, I guess. What was your experience of meeting him when you were a teenager and falling in love with him?
Don't really know how to explain it. I was a child, and I think I had sort of held a candle for him before I actually officially met him, because he was older than me. He was higher up in school. He was quite popular. He was part of the athletic team. So there was already a sort of attraction there before we even met.
And then when you did get together, and very quickly you fell pregnant.
3 years.
Yeah. But in terms of your age, I mean, you'd known him for a few years. You were only 16 at the time when you got pregnant with your first child.
Yeah.
Suddenly you were in a relationship with him. What was he like when you think back to it now? Did some of the sort of the controlling, coercive behaviour that we've come to understand is his way, do you see that now when you look back?
I see it looking back, 2020 is hindsight, but because I was so young, I didn't realise it at the time, so for me it was just normal. It was my first serious relationship, so I didn't have anything to compare it to. But yeah, looking back, there's definitely things. It was all very much about him and how he wanted, and you just had this inkling that if you didn't do things the way he wanted it, there'd be consequences. So you'd change your behaviour in order to please him without him having to say you have to.
It was a very controlling relationship for both you and Victoria, actually. I think she had the same thing, because Maddie, she was reporting to you and she wasn't being completely honest at all times, I don't think. And he'd actually attempted to kill her before.
He had. It's quite convoluted how we ended up there, but once we'd spoken to her on a video previously, and she'd given us an outline of their relationship. When I arrested him, my colleagues then had to go and tell her that he wasn't coming home. He was being bailed away from the home. And at that point, she told them about a gas leak the week prior to the parachute incident, which it transpired he'd also done to try and kill her.
And didn't he say he try putting the cooker on? I mean, he was
encouraging her.
He really was.
He was. So she had messaged him at work and said, I think there's a gas leak, and he said, have you tried the stove? well, she hadn't, thankfully.
But you described her as a hostile witness as well. Can you just explain what that means to sort of the layman?
So when we had 2 trials. In the first trial, she was a witness, and when she came up onto the stand, she then started to change the story that she had told us originally. She said that he had not been... So he had taken her parachute to the toilet, and we believe that's when he had tampered with it. And she started to say that he had not been in the toilet for as long as she claimed initially, that she was gunning for him. We just told her that he was having an affair and he was denying paternity of their son. So she was gunning for him. And she then said that, in actual fact, she thinks she cut away a good parachute, and that she, you know, it didn't fail. She cut it away because she had panicked.
I mean, years later, now when she's reflecting on this and the trial in the documentary, she's more honest about how she sees things. But back then, she was clearly still caught in this spell. This coercive control that he had over her was so compelling.
It's certainly, when we analysed the situation, we deemed that she was in a coercive, controlling relationship. And he had the strongest hold over anybody I have ever come across.
I wonder, Nicoline, how you feel. I mean, what he ended up doing to you is he ended up deciding, as you said, it was all about him. You're pregnant, you had a child. He decides he's going to move to England because that's what he wants to do. And then he ends up marrying someone, even though you were engaged and you only heard about... I mean, it's extraordinary what he put you through. You then come to England, you sort of get back together with him. All these years later, when you see what happened to Victoria, I wonder how you feel looking at the relationship from the outside, from your perspective.
Looking at their relationship.
Yeah, and what you went through and perhaps how lucky you were that you weren't in that situation.
I dodged a bullet.
Yeah.
Well, there was a lot of parallels between mine and Victoria's relationship with him, with certain things that he did, like denying paternity of a child, cheating all the time, those kind of things. Some that I probably would never even know about. Yeah, I feel lucky.
Have you ever connected with Victoria? Have you ever been able to speak to her?
I would love to, but no, I haven't.
Because there will be some shared sort of, I don't know, experience that the two of you together might be able to help each other through what you went through. Because I'd imagine, Maddie, that is the thing. It's like this experience, the reality of it, the headlines, the story.
Yes.
It's something that will stay with all of you that have been under his spell.
Oh, 100%. I think in many different ways it affected us all.
And you identified with it very strongly, didn't you?
Yes, absolutely. I was in a fairly dysfunctional relationship at the time and could identify with Victoria and what she was going through at that time. Yes, absolutely.
Yeah.
So it has affected a lot of us in many different ways. And I think mentally it would take Victoria a while to get through that. Physically she may have healed, but I think mentally, you know, it's like we say in the docudrama, you carry the scars with you.
Absolutely. Well, it's absolutely intriguing. It's gripping. You can't stop watching it. Thank you so much for coming on the show this morning and for telling your stories. The full Skydive murder plot is on Tuesday. That's tomorrow at 9 o'clock on Channel 4. Thank you, ladies. Thank you very much.
And if you've been affected by any of the topics that we've been discussing in this item, you can head to our website where there are helplines that I'm sure will be able to help.
Thank you for visiting our This Morning YouTube channel. We upload new content every day, so go ahead and hit that subscribe button so you don't miss out. And we'll see you in the morning.
We are highlighting an issue that's very close to our hearts here at This Morning.
Yeah, so last month, a 12-year-old girl with a peanut allergy was reportedly thrown off a plane with her family after airline staff refused to make an announcement requesting passengers refrain from eating nuts.
Legally, passengers can eat and even purchase nuts on planes, despite peanut allergies affecting 2% of children.
Yeah. So to highlight the issue, we're joined by campaigners Nadim, Ednan Laperouse and Lindsay Bowers, who both know firsthand the various serious consequences of overlooking severe food allergies, alongside Professor Adam Fox, who's a leading expert in paediatrician allergies as well. Nadim, thank you so much for joining us, all of you. I don't want to go over or make you retail the story too much, but can you tell us briefly about Natasha and the terrible circumstance?
Yes, so my daughter Natasha, she was allergic to a number of foods, including sesame seeds. And back in summer of 2016, when I was going on a short holiday with her and a friend, taking a flight from Heathrow to south of France, We bought a sandwich for her in the Heathrow Terminal 5, and it looked perfectly fine to eat, and the ingredients had no mention of sesame, to which she was allergic. But she ate the sandwich just before boarding, 2-hour flight, and about halfway through, she was really, really unwell and had a serious anaphylactic reaction, which is a really powerful allergic reaction to something that she'd eaten. We weren't sure what, but very quickly the situation turned really bad mid-flight, and I injected her with 2 auto-injectors of adrenaline.
Did you have those with you?
Always, because people who are seriously food allergic know their circumstances, as do their families if they're children, and also carry always 2 of these devices, really, just in case. It's a good precaution. I used both of them, an adult dose. It made no difference whatsoever. She collapsed on the plane and went into cardiac arrest, and by the time the plane had landed, she was almost dead, and she was taken off the plane dead.
So sorry, Nadim.
No one wants to see their child in that situation. And the worst thing was her mum wasn't there either, was she?
No, my wife and her mother wasn't there. It was terrifying to have to make that call to her once we'd landed to give her the news, and she was back in London and she just collapsed. Yeah, very tragic situation.
Nadim, you've dedicated your life to raising awareness of food allergies. Can you tell us a little bit about Natasha's Law and what you wanted to do and what it's done?
Yes, so back in 2018, there was the inquest into the death of our daughter, Natasha, and that brought certain things to light in the public domain. And Tanya and I, my wife and I, we realised immediately that there was a real threat to other people's lives here, because the coroner said explicitly that a loophole in the food laws was being used by large food companies, which basically meant they did not have to put the full ingredients on food products that were packaged. They could write whatever they liked. Some of the ingredients, none of them, partial ingredients. And of course, for food allergic people who really rely on labels and ingredients to see what's in the food, to make a decision for themselves, the right one, that is a very, very dangerous situation. And so we campaigned very quickly, started campaigning, meeting various government ministers and so forth, to make a change in the law, the food law, to close that loophole, to stop big food businesses basically getting away with, well, potentially very tragic situations for millions of other food allergic people in the UK. And that law passed through Parliament in 2019 and became effective 2 years later across the UK, and has made a huge difference to millions of people.
Of course, yeah.
It's unbelievable. We're going to move on to Lindsay now. Morning, Lindsay.
Good morning.
We know you very well because obviously you've worked here at This Morning, and someone who we absolutely adore, Amy May, who you were really close friends with, weren't you, here when you worked here at This Morning? Tell us a little bit about Amy.
She was my best friend here, and she lit up a room when she walked into it. Everyone knew her. She dressed fabulously. She had amazing hair and makeup at all times. And while we worked here together, we were both 2 blonde, bubbly girls from Essex. And we just became really, really good friends really fast, and just spent a lot of time having a massive laugh, basically.
Amy's circumstance was that she was away in Hungary, wasn't she? And she even had
cards
to say that she was allergic to.
Yeah, she went to Budapest on a girls' trip and had cards in Hungarian saying I have a serious allergy. And unfortunately, she went to a restaurant and her food was contaminated, and she had a catastrophic reaction. Her brain was deprived of oxygen for 6 minutes. And she went into cardiac arrest, and she's now left severely brain damaged in a wheelchair.
And she has been on the show before, but she's in a situation now where she can't really come on the show. She can't come now.
Yeah, before she still had some kind of life in her. She would laugh, she would smile, she would show a lot of acknowledgement of the things you were telling her. But in December 2022, she started having a lot of seizures, repeatedly so, and she was on and off lots of different medication. And since then, she's just so depressed, so angry. The last couple of times I've been to see her, she's just not the same Amy. You don't get the same belly laughs. And it's a lot bleaker now.
It's so sad. And how's her parents, Sue and Roger? How are they doing?
Not good. You know, Amy's their only daughter, and every time I see them, I can see just how much this affects them. Every birthday, every Christmas. Even, you know, if I have something going on in my life, I feel guilty for celebrating it because there's always that thought of Amy should be celebrating things in her life as well, and she can't.
We know they're watching today, and we send them all our love.
We do.
Can you tell us a little bit about the Amy May Trust and what the purpose and the goal is?
Yes, so the Amy May Trust was set up by her Aunt Julie and cousin Tom, and really it's to cover the immense costs of her therapies and her medical needs, because she's been through rehabilitation, she's had speech therapy, hydrotherapy, all sorts of things, just keeping her comfortable and happy. It costs an awful lot.
Oh. And obviously she's still very part of our family, isn't she, here this morning? Also, let's go on to Professor Fox. How common are these nut allergies?
So nut allergies affect about 1 in 50 children. And many people will think, well, when I grew up, that it was really rare to be allergic to nuts, and it has become a lot more common. And certainly through the 2000s, we saw around a trebling of the number of people who suffer from nut allergies. So now most classrooms in any school, there'll be somebody with a nut or certainly a food allergy.
What's the best way of preventing them from happening?
There's a lot of exciting research over the last few years that suggests that if during early weaning of infants, the foods that you're at risk of becoming allergic to, so peanut, for example, are introduced without delay at all. So rather than putting off the introduction of them as weaning foods, including peanut butter, for example, sesame, egg, as weaning foods from as early as even 4 or 5 months, might reduce the risk of those allergies developing.
It's funny because my wife has a nut allergy, and which is easier said than done because she obviously can't wean our son onto peanut butter, but that's what we've done. We've tried to introduce it to him as early as possible.
This is all obviously thanks to the Natasha Trust while all this research is happening, isn't it?
Well, there are several really interesting studies going on, and Professor Adam Fox is referring to one of them that was done quite some years ago that produced results really that showed that if you early weaning of ordinarily allergenic foods, as you were describing, is beneficial. Natasha's foundation, the charity, the UK food charity, has been funding a £2.5 million clinical trial across 5 big hospitals in the United Kingdom to desensitise children and young people for their food allergies to peanuts and to cow's milk, which are probably the 2 worst allergens in the UK food system in society. And recently, there was some news that came out that was showing that although the trial isn't finished yet, and we really must wait for a trial to be finished to get a full, proper result, early indications show that children who are on the trial are really benefiting. And previously they couldn't eat any nuts or a fraction of a nut, and a matter of months later they're eating 6 peanuts a day. And that's without the use of any drugs or pharmaceuticals. It's actually using shop-bought foods to treat them, which is seems quite revolutionary, really.
Absolutely.
Should add, it's really important that people don't try to do that themselves at home. It's important that that's done under very careful medical supervision.
Can we just quickly go through the signs of someone who's going through when they're in shock?
Well, most reactions will thankfully be mild. So the typical signs will be very quick after eating the food, itchiness around the mouth, swelling, hives, things like that. But even an early sign of a more severe reaction, so that would be persistent coughing, any sort of difficulty in breathing, change in voice, or any suggestion that your blood pressure's dropping, so dizziness, confusion, those are signs of a more severe allergic reaction. And the most important things to do then are make sure somebody's calling for help. If there's adrenaline available, so an EpiPen or a Jext, get on and give it. It's a very safe drug. There's no reason to delay. And if you're not sure if it's bad enough, give it anyway and ask questions after. And if it's not better within 5 minutes, give the next one that you've got. And also lie the patient down as well. If they're uncomfortable because it's hard for them to breathe, they can sit up, but don't stand them up or try to walk them around.
Why is that?
Because that will make the blood pressure drop even further. Right. And it's been shown from a number of studies that if you stay lying flat, that's your best chance, and even raising the legs, of keeping the blood pressure up during that critical time.
Do you raise the legs?
So you can raise the legs, but make the patient comfortable, but really lying down and not moving them around.
Thank you.
Yeah.
Thank you.
Professor Fox, Lindsay and Nadine, thank you for joining us, and thanks so much. And once again, sending lots of love to Amy May watching at home.
Thank you so much for visiting our This Morning YouTube channel. We upload new content every single day, so go ahead and hit that subscribe button, and we'll see you in the morning.
Now, it's been 9 years since our next guests went on their first official date, a day that neither of them would ever forget.
Yeah, what was meant to be the dream date quickly turned into a nightmare for then teenagers Leah and Joe after a catastrophic roller coaster crash at Alton Towers. It left them with both life-changing injuries.
Yet, despite the tragic circumstance, their relationship overcame the odds, and they join us today, fresh from their honeymoon, with the happy news of their marriage.
Yeah,
Congratulations!
congratulations.
Yeah. How was the honeymoon?
It was amazing.
Yeah, really good.
But it's not like the official honeymoon, really.
No.
That's
No.
like a mini moon.
Yeah.
Oh,
But
fantastic.
I have a mini moon, Babs.
I didn't know there was such a thing as a mini
The
moon.
mini moon, and then
Yeah.
it gives you an excuse to say to all your friends and family, but we're going to go away on the big honeymoon later.
Yeah.
I love that. How was the wedding? How did it go?
Oh, it was amazing.
Amazing. Everything and more that we could have asked for,
Yeah.
like 100%.
Really?
Yeah.
Just everything
look
went
at
to
the
plan.
dress. Oh,
Yeah.
my goodness, it's beautiful.
It
Yeah.
does feel like... I remember this story like it was yesterday. So it doesn't... 9 years is extraordinary.
Yeah.
It's flown, honestly,
Yeah, it's mad.
hasn't it?
Like, it does seem like it was yesterday, to be fair, but so much has obviously happened in between, and obviously now we're married.
I can't believe that fatal day, that awful day, was that was the first date that you were on.
Yeah.
Yeah.
So how did you even meet? How did it all even happen?
We had like mutual friends.
Yeah.
And then Joe started talking to me on Facebook, as they do.
And you were
it
in?
just
As
yeah.
they do.
Yeah.
Well, those seats hanging around there.
And then it just kind of went from there, didn't
Yeah.
it?
Yeah.
We went
Pretty
out
much.
for like a couple of meals and went to the cinema and things,
Yeah.
and then went to Alton Towers.
Yeah, that was
and-
like his first like big outing
Yeah.
together, really. Yeah.
Yeah.
So it wasn't the first time you'd met now.
No.
No.
Obviously, we don't want to focus too much on the day because this is a day. This is a story of happiness and it's a story of incredible resolve and friendship.
Yeah.
But what do you remember afterwards, and how did the relationship then start to foster? After during your recovery.
I think it were difficult, to be fair. Like we've said numerous times, like if that had probably not happened, we might not have been together now.
Really? Why?
Because things just change and things just get in the way. Like we were both obviously going to uni, like would have been living separate cities. Like it's just, I don't know. I don't know. Only time would have told, wouldn't it? But yeah.
It were very early days, and I was starting Leeds University in the September, so we would have been like miles away from each other. So I don't know if it would have stuck.
Did
and
either of you get to
lasted.
university in the end?
Joe was at uni.
Yeah, I completed mine because I were a year ahead of Leah even starting.
Yeah.
But yeah, I just think the accident 100% brought us closer together.
Yeah.
Like, we had nobody else that could relate to obviously what we were going through apart from each other.
Sure.
So it was kind of common ground.
When you were going through your recovery, did you actually speak to each other and phone each other and see how you were getting on?
Yeah, so after the accident, we were in the same hospital. So I used to go up and visit him in his bed, and he used to pop down and see me. And
That's your courtship period.
yeah. In hospital.
You're like, we're waking up going, it's here again.
That's unbelievable.
Yeah,
We had
it was
like
so
Chinese.
weird. Yeah, it was like, but it was so awkward. Like it was so weird because we were literally starting it fresh,
Yeah.
but surrounded by obviously press, parents. Like it weren't natural.
Physio,
It was
appointments.
strange.
So when did it become natural? Because obviously there would have been a friendship there. You would have been bound by this terrible event that happened to you. So, but when did it? You obviously had feelings for each other, but when did it sort of develop into okay, we're just kind of dating now normally?
Yeah.
Yeah.
Probably about 6 months into it, like
Yeah.
after the accident, because like you weren't driving, we couldn't do anything on his own. It was just literally us and his parents in wheelchairs, trying to do his best.
Sure.
So until we had that independence, were probably when it started to become more of a
and then
relationship.
we could just kind of start fresh, really.
It's unbelievable because obviously you lost your left leg, so you was
Yeah.
in a wheelchair. You had severed fingers.
Yeah.
So did you have to like learn how to push the wheelchair?
Yeah.
It must have been so difficult.
Yeah, it were. Like, obviously, both my kneecaps were shattered as well.
Yeah.
And then, obviously, my hand injuries as well. So I remember, like, his first, like, date that we went on when I'd first started driving and we were
Where did you
pushing this
go?
wheelchair. I think it was, like, Yorkshire Wildlife
yeah,
Park
we
or
went to
something
Yorkshire
like
Wildlife
that. And Leah were like, how are we going to manage with this wheelchair? Like, we've never done this before. What do we do? But,
We managed it.
yeah, it was sound.
Did
But
Did you find laughter quite early? because of that.
You had to.
Yeah, right.
I think if you didn't laugh, you'd cry. Cause your body, both as bodies had changed so much, and we were learning to like move on with these injuries. So if we didn't laugh, we'd have cried.
It's so true, it's so true. And I heard, Jo, you was a little bit emotional on the big day when she walked down the aisle.
Very emotional.
Didn't you warn him though, say, if you don't cry, I'm going?
Yeah. Like, if you're not crying when I walk down the aisle, I'm walking the other way.
Yeah. So really, we're all fake. I'd practice. No, I'm joking.
No, is it quite over? I suppose with your family there.
Yeah.
I suppose the whole situation is quite overwhelming, isn't it?
Yeah, 100%. Like, I knew as soon as she walked down, like, I knew her entrance song, I knew the minutes that she were coming in and the bridesmaids were coming in because she'd practiced that many times. But it is, once you see your friends, your family, like, it just, a different emotion kind of just takes over you.
Oh.
I think weddings are emotional anyway.
Yeah.
I love a wedding.
Yeah.
I do.
Did you ever almost feel like it was happening to someone else? It's an out-body experience, a wedding in many ways.
Yeah.
We keep saying, like, we keep watching back videos and stuff, and we're like, it just doesn't feel like it actually did happen.
No.
I just saw that clip there with all the glitter. How much glitter was there? Who did that glitter drop? That's like a Strictly glitter.
Yeah. We had two of his friends do confetti cannons.
Oh, it's so
on his
lovely.
first dance.
Yeah. How did he propose?
In Venice. No, Venice.
Yeah. Smoothie.
On a gondola?
No.
No,
We'd
how
just
did he
been
do?
on a gondola.
Yeah.
And then we were just taking pictures, weren't we, like, round Venice. And I had some pictures to take in some outfits. And we went down, like, it's an alley, but I don't want to call it an alley.
It sounds really seedy. It was like a quiet street.
It's the best line. Drag me down the alley and then...
Nice.
No, it was just like a quiet...
full of, like, little street. We'll call it a little street.
Yeah.
Next to, like, the river. So
I
really
wouldn't,
nice.
never be presumptuous to say that we know you guys, but your energy is extraordinary and you are so inspirational to people.
Thank
You're just you look into the future.
Yeah.
You're not defined by what's happened to you.
Yeah,
You're
definitely.
just doing your thing.
We're very positive people, and I think we've definitely got the positive out of what's happened.
And you're doing a lot for the air ambulance for the Midlands, which is great, and Limbo as well, aren't you?
Yeah. So we've just started planning a big charity ball for next year,
Lovely.
as it's 10 years since the accident. So we're going to raise money for the Midlands Air Ambulance, Yorkshire Air Ambulance, and then Limbo Foundation.
Wow.
Yeah, what would you say to people? We interviewed Craig McKinley last week, so someone who's lost his limbs. What would you say to people that are going through what you've been through? At the start of that journey?
It's hard. It's very hard, but you've just got to keep going, and life does get better.
Yeah. Brilliant. Thank you both.
Thank you so much, Leah and Jo. Thank you for joining us.
Thank you.
Thank you so much for visiting our This Morning YouTube channel. We upload new content every single day, so go ahead and hit that subscribe button, and we'll see you in the morning.
It always moves me so much when I hear him perform because he's just a young lad from East London. And he has the superpower with words. How are you?
Emotional.
Oh, yeah.
Yeah.
Why?
Just because we're here and this book is like, seeing you holding it, you're holding a piece of so many people's hearts.
Yeah.
And like, for me to be sat here, colour coordinated, obviously I got the memo with your bottoms and Ben's top. Like, I just feel like it's such a moment.
Yeah.
I'm 33, I've been writing since I was 15.
Yeah.
So it feels like my first day.
Well, and also, you've got some amazing people to contribute to the book. I mean, some, fair to middling as well.
Some are easier to get than others.
But you must feel an incredible sense of responsibility in order to get it right. And it's so important to so many people.
Yeah. And I'm incredibly thankful to everyone who trusted me because it's such a sensitive, delicate situation and responsibility is the right word. And I'm thankful to my family, my sisters and my dad and my nieces and nephews for understanding that I'm not around because this took so much from me.
So the essence of this book, Hussein, you've written poetry in the past and Life is Sad and Beautiful was such an amazing book. But this is about, I wanted to quit too. This is about those moments that everybody has been through where you wanted to get their little sense of a moment in their life, despite how it might seem, where they've wanted to quit too. So you've spoken to actors and musicians and business people and influencers and leaders in industry. And it's an incredible anthology of their moments where they wanted to quit too.
Yeah, and it was accidental. This book was never part of a plan in life. But I was having a conversation with a friend of mine, Sinead Harnett, and led me to saying to her I wanted to quit. And we started talking about it. And I hate the title I hate the title of it because of how real it is.
Yeah.
When I even say, oh, a book's called I Wanted to Quit Too, it reminds me, but I should hate it. It should make me feel uncomfortable.
But I think that's why people identify with it so much, because of the title. It's that thing that draws people in. And, you know, from you losing your mum and just talking about those little moments in time where she stays with you and those little bits of advice that she'd give you.
Yeah, she's amazing. And I feel like she'd be mad at me right now.
Why? Oh, your birthday. Is it the birthday she'd be angry about?
I got her birthday wrong in the book. On the third page.
On the third page?
Yeah, Uncle Larry Lamb pointed it out to me. I didn't know your mum was 70. I said, she's not Larry, she's 49. He said, well, why did you put she was born in 1947? And I'm like, I can't blame the editor on that one. It's my fault. But I felt like that's her reminding me, like, don't take this too seriously. And it's 7 years since she's passed, and I'm thankful, Mum, for all the lessons you taught me beyond your grave, because they don't leave you. They never leave you. They're with you, and you have to understand that. No one can tell you that. You have to understand that.
There's some as Kat said, there's some incredible people in this book, but there is an advert for the book as well that is voiced by someone extraordinary. We're going to play a little bit of the clip here. This is the advert for the book.
Guess who it is?
To be wise is to know great failure and victory, to have experienced all, and to have made every mistake in the book.
I wasn't sure who it was when you first played it.
Excuse me, you say, Manuel. That's Tom Hardy voicing the advert.
It is. I can't believe it myself. I can't believe it myself. I'm so blessed, so lucky, so fortunate to have met people, and they for some reason, trust me.
We do.
With their voice and their words.
But also just having that chance at 14 when your teacher said to you, you go and do this poetry slam and do it, and believing in you.
He was like, you always got something to say, go say it there. And I was like, all right, I will. And then I walked into this room and people are performing and people are clicking, and I'm like, oh, I want some clicks.
Yeah.
And then that changed my life. I entered a portal, like Narnia. I entered the wardrobe and I came out the other side, and every day I feel like it's my first day at work.
Well, you've created an amazing book. Thank you so much.
It's Top 3
I wanted
Sunday
to
Times
quit
bestseller
too.
list.
It is out now.
Thank
you for joining us this morning.
Thank you for having me.
It's always magical to see you. In colour coordinated outfits as well.
We're going to carry on.
I got the memo.
Here's your weather.
Oh, hello. Thank you for visiting our This Morning YouTube channel. We upload tons of new content every single day. So hit the subscribe button, like all the videos, and don't miss out. We'll see you in the morning.
As far as true crime stories go, few captivate like the saga of Gypsy Rose Blanchard, a young woman from Missouri who persuaded her online boyfriend, and she'll be speaking exclusively to This Morning to reveal what life is like after lockup. Gypsy Rose, thank you for joining us on This Morning. What has life been like since your release in December?
Life has been a whirlwind. For the last 5 months, I've gone through a lot of changes in my everyday life, in my love life, home life. So the last 5 months have been quite an adjustment.
You know my story. Now let's see what I do with my life.
These last 5 months since Gypsy's release have been documented in a new series, Gypsy Rose, Life After Lockup, set to broadcast from next week.
It showcases the emotions that I went through. It showcases the hardships, the joys, the little bit of everything, because people are getting to read how I've been doing online, right? But they're getting little bits and pieces of everything, and there's room for, misunderstandings. With our show, people will be able to actually be a little fly on the wall and get to be as if they were in the room with me on a daily basis. And they'll be able to make their own assumptions of what all happened in these last 5 months instead of just reading here and there about it.
After your release, you've found a newfound fame. You're huge on TikTok. You're going to red carpet events. You've got your own show. You're hanging out with the Kardashians. Do you think it's right that you've taken your newfound fame so enthusiastically?
I wouldn't say enthusiastically. I think that this was sort of put on me before I even got out of prison. I think my story had reached a lot of people. And so I came out into society not really expecting the level of fame that was around me. And it's like, sharing my story was a very selfless thing that I feel like I'm doing. And there was never any intentions of wanting the fame aspect of it. As for the Kardashians, that was to talk about prison reform. So again, another selfless act that was not for any attention, but to highlight what prisoners go through on a daily basis. She and I are similar in the ways of labels get put on her, labels get put on me. And so to sort of see the woman behind the labels, I was actually surprised that she's so down to earth and relatable.
How are you finding the fame?
I try and shy away from it sometimes. You know, on a daily, I'm kind of like, I just want to be normal. And I'm finding that, you know, my life is not normal. And finding that little bit of normal in my everyday life is a challenge. And I treasure that.
What would you say to anybody that says, you know, you should never in a million years be getting this level of fame? You should never be hanging out with the Kardashians, and you certainly shouldn't be getting your own show. What would you say to any of those people?
This was not a choice. Like, this was something that was out of my control. What I chose to do is share my story and set the record straight going forward.
You went through the most horrific abuse, but why did you not expose your mum's lies to the police? Why did you take it as far as what you did?
Honestly, I didn't know the extent of the abuse myself. Some things were very obvious, like the physical abuse, but there was other things in the medical abuse side of it that if it wasn't very visual, like my mother said I had cancer. You can't see cancer. And my mother was telling people, myself and others that I was on cancer medication. So there was things like those little thhave that I didn't even know until upon arrest after the crime.
Have you got any regrets?
Oh yeah, I have lots of regrets, lots of things that I would change. Obviously the big one, that goes without saying, but that's on my conscience. I have to live with that on a daily basis. Yes, I did my time. I did 8.5 years, but that was a prison sentence. The emotional and mental regret that I have to live with goes for the rest of my life.
Wow.
Goodness me, what an extraordinary interview and what an extraordinary story as well. You can find out more about Gypsy's story in a documentary, Gypsy Rose, Life After Lockup, which is going to start next Monday on the 10th of June, 9 p.m. on the Crime and Investigation channel.
Thank you for visiting our This Morning YouTube channel. We upload new content every day, so go ahead and hit that subscribe button so you don't miss out, and we'll see you in the morning.